Shine, I'ma shine. I'm not one for wasting time. I'ma make that shit that gon' go have you wait and stand in line. Shine, you gon' shine. Don't you go and waste your time. I know you feeling down, but I know what you got deep inside. Shine, I'ma shine. Shine, I'ma shine. Shine, you gon' shine. Shine, I'ma shine. I'm not one for wasting time.
All right, what up, what up? Welcome to Painter Game. My name's Dr. T.
I'm Timo.
Welcome in. It's been a little bit. We had some technical difficulties. The COVID hit us. Not me in
COVID
particular,
protocol.
but COVID hit some of us, and so we had to go away for a little bit. So it's good to be back.
It was during like a holiday, too. So it was all right. So what'd you do for July 4th?
We went. Me and my better half went over to. We went up to Folsom and Apple Hill. Went over there and did a little weekend getaway type of thing. Went to go get some taste. We went to pick some strawberries. We got to taste some wine. We got some.
Oh, really? Sick.
Yeah, it's pretty sick.
Which one did you like?
There was actually like a blueberry wine that was pretty dope.
Wine?
Yeah,
Okay,
there was apple wine and
So-
it was like not the coolest. But some of this apple cider is overrated. Some of it is, but it's a lot of it was really good. Didn't have any bad food there. We went to like a winery down there. It was all really nice.
Pretty sick.
We had like a little photo shoot. We helped out a friend who needed to like build her portfolio and stuff. So we had a little photo shoot for them.
Oh, nice.
It was kind of nice. Getaway weekend. Came back. My dad grilled me some barbecue ribs for. He did put them in the sous vide. You know what a sous vide is? The like water.
Yeah.
You put them in like the water thing. So
I
we
worked
did
at
that.
a French restaurant. We used to do it.
It got like melt off the bone.
Yeah,
We like
pretty
picked.
sick.
We tried to get a char on it on the grill, and as he was like flipping it,
It
it would
just
like fall off.
yeah.
And we were just like, it's perfect. Don't worry
It's all
about it.
good.
But that
Yeah,
was good. What were you doing this July 4th?
I actually was pretty busy over the weekend since I bartend on the weekend. So it was a really busy July 4th weekend.
Oh, yeah.
So Saturday and Sunday, crazy busy. I actually broke my personal record of how much I made in a day. It was a 9-hour shift, but it was definitely worth it.
I thought you were about to say you like broke a toe or something.
No. Definitely didn't break a toe,
Didn't hear
but I
about
broke
that.
records.
All right.
There's a record setting
making money
day.
moves.
Yeah, so that was cool. But the actual July 4th, I actually went with Young Butter's baby and his girlfriend, and we went to go watch The Rise of Gru. Because I told him I like had nothing to do.
Interesting.
We were supposed to go to the Blue Jays and A's game, but COVID hit us. So we ended up just kind of doing something a little bit low key. I saw The Rise of Gru. Pretty funny.
I heard a lot of good things about it, but I've
Yeah, it's
also
cool.
heard it was like a TikTok meme thing that everyone was going for. So I was like, I don't know. I'll just wait for it a little bit. I'm not gonna go.
Yeah, you don't have to go out
Was
your
it
way
good,
for
though?
it. But it's good though. It's like,
As long as-
it's
as
the
long as it
Minions.
entertain you. Yeah.
Minions are they're always fun.
Can't go wrong with that.
Yeah, you definitely a good couple laughs. They always have jokes for like adults and kids, so it definitely worked out.
Yeah.
Yeah, so it was cool. Definitely had a good July 4th.
How's the clientele been?
So far so good. Yeah. Everybody's working out pretty hard. I had a couple people leave, so I actually was I had very like long breaks. So what I ended up doing was just shortening it. So I shortened it. I just put like, okay, cool. If I could come for this amount of hours, you guys could fill it up yourself, or we could set up a schedule. But a lot of people took vacations, holidays and
As
stuff
it
like
goes,
that
as
too.
it
Yeah.
goes.
And then I was kind of even contemplating like, damn, what should I do? I don't know if I even mentioned on Pain and Gain. It's been a while. But I got a new job technically.
Okay.
And
More hustle.
the service is that I go to people's homes. Did I talk about that? I don't
Okay.
know if
No,
I
it's
did.
like a home health, home train.
Yeah,
No,
exactly.
tell us
so
about that. I don't know
yeah,
about
so
that.
so it's pretty cool because so basically I get clientele from them, and everything works off an app, which is pretty cool. So I could set up like a whole full out workout
so
through
it's
an
like
app.
you have another thing giving you the patients in a way.
Yeah, exactly. It's
Okay,
another
okay.
company basically throwing clients at.
That's
for me.
nice. That's nice.
So that was cool. But yeah,
you
so I
busy.
had a couple people that I actually went into their homes, and then it's kind of interesting too because the lady that I was working out, she's actually never done anything athletic, never done anything what she had to work out for it because the doctor said that she needed to work out so she could boost her hormones because she wants to get pregnant. better hormones,
Interesting.
or something like that. It's HPVC, I want to say. I could be wrong on that one too, but something like that.
Yeah.
But so yeah, but so she's been pretty cool. Just kind of going through motions and like teaching her how to move her body and stuff like that. So that was really cool and interesting. Because usually I always get somebody that has some type of background or something kind of like,
Right.
related, like, oh, I used to play badminton or whatever. But for the most part, for most of my clients, but she was literally like, I don't
So
know.
is your goal in that to teach them how to use the stuff they have at home, or do you want to get them a home regimen, or do you say you should like try to get this, or what's
So
is that like
for
a doctor
her,
prescription service? How does that work? I've never heard of that.
So they actually go super in depth. I really love the company I'm working for. They really go super in depth of helping them. And then so they broke it down and they give me all the information. So they do a whole thorough check with them, their doctor, everything, all this, the whole
Right,
thing.
make
So
sure they're like equipped to do it.
exactly. So
Okay.
everything was cool. And then from there, it was just really a handoff because one of the elite trainers couldn't take care of her anymore because it was a scheduling situation. So from where he left off, he kind of like gave me the, here's A, B, C.
Yeah,
If you
give
want to
like,
try
the
some of the thing.
notes.
Yeah. So, but the one thing about her, she was actually like canceling all the time. So
That's
they're
tough.
kind of getting into a situation where it's just like not working out. I'm scheduling her. Maybe you could try to take her on and try something different. Because he was also saying like we're kind of not like not getting along, but it's not kind of working. The personalities isn't there. So, sometimes, and that really is important. So
Right.
they wanted to give
Commitment.
me
You got to have something like that.
yeah, exactly. So we were doing it for a little bit and. But yeah, so I just kind of kept it simple, super,
Okay.
super simple. They said she had a low, energy level. So half during the workout, she was kind of like, I'm done. But she was like, I got 30 minutes left, you know what I mean? So it was just the motivation.
But as you go, it'll raise, and you got to talk to them, educate them.
But yeah,
not a
so but it was
medical.
really cool too because they always do an assessment, a reassessment, like around like depending on how long the program is. And I did a reassessment with the CEO of the company, or with the two CEOs of the company. And so that's how hands-on they're on. Like it's
Okay.
not the CEO.
Do
like,
they have like objective measures? Like they use the
step
time
test?
stand.
Yeah, YMC test, the step test.
And they do the heart rate with the step test.
Heart rate, body fat percentage off of
Nice.
those nice little scales, like literally fully in depth. And
Alright.
I love it because I was like, that's exactly what people need because a lot of people just don't understand. It's like you have to measure something and
And it has to be
see something.
objective, and it has to be something recreatable, and you have to have something where everyone else can do the same thing.
Yeah.
That's the thing that a lot of people don't understand is it's really tough to be able to it's tough to have a recreatable exam. And this is something like the step test where it's all right, you're stepping up and down 6 inches. Here's 2 minutes of it, and you're getting your heart rate afterwards. Recreatable, you can do it again and again, and anyone can administer it, and anyone can do it, and it's cut and dry. And that's like a big deal.
They did a plank test, and then the other one was a shoulder tap. So when you go and push a position, and you just tap your shoulder. So the things that you can
Interesting.
like. So it was like body control, it's just strength, body control and like how you can maneuver your body. And she did
Stabilization.
Yeah, exactly. So she actually just blew her numbers out the water, and
Wow.
so she was it kind of, and then from there you're like, oh wow, I really did that. You kind of impress yourself a little bit. And I think that's what happened in her assessment. So she's actually going through a personal thing right now. So her sessions have been suspended for a little bit, but when she comes back, she's gonna do another training session. So
That's cool.
pretty cool. Yeah,
That's cool.
yeah. So
That's
a
a
lot more
nice-
coming. What about you?
July's been a little wild for me. I've had a lot of usually go through waves, which is weird. Like I'll get a lot of necks, or I get a lot of knee replacements, or I get a lot of this. I've had a lot of thinkers lately, so I've had a lot of where I've had to kind of do my own research of not always perfectly equipped, and that's kind of that's one of the things that you need to look out for in healthcare is if you get someone who never says they don't know, they're wrong. And so recently I have one just coming up where it's like a hereditary disease, like a partial paresis, which is like a weakness, like a almost paralysis. I don't know how much it is, how little it is, but it's one from birth, and we're trying to get. And they're talking about transfer training and this and that. And I was like, I've never. There's so many syndromes, so many diseases, so many things that happen with people that you'll run across some that you never hear before. And so, This one I've heard of they did a couple procedures, and I've heard of the procedures before. Never had them compounded into one person before, on top of mixing it with hereditary conditions. So I've actually had to study for a little bit about reading up on stuff, looking through the research, what's good, what's bad, and then just like spinal cord injuries, just things I'm not used to seeing out in like a general outpatient orthopedic world. So I've just had I've been tired when I've been getting home. My better half's been taking care of me as I kind of drag myself in.
Help me.
Yeah, drag myself in. She's been cooking some good dinners, and I'll try to do dishes and stuff to help out if I can. But yeah, I've been thinking a lot. So that's good and bad.
Yeah, at least you're learning something new. It kind of keeps, that's the cool thing. And
keeps you busy, gets you out of the monotony of, all right, I got 4 knee replacements today, and I have this shoulder rotator cuff repair, and I have 7 of the same surgery. So it's nice to think a little bit, but it's I would like just 1 or 2 a week, not like 6. That'd be cool.
Just built up on you, just said, hey, time to study.
Yeah, I would like that a lot. That'd be cool.
That's cool. That's what's up.
Yeah, it keeps you going. So today we were going to do a little bit of demonstration. I think we talked about it last time we were on Banner Gain, which is unfortunately like a month ago almost.
Yeah, almost.
But we're going to talk about cupping. So cupping is something that a lot of people have seen out in the wild. Made very popular by Michael Phelps during the Olympics in the 2004 or 2008.
Was that the thing?
He had the big old purple spots on his shoulders and back and stuff.
And everybody was like, "What is it?"
Yeah, and that was kind of the same thing with like the Kinesio tape, the K tape, the rock tape or whatever with the Carrie Walsh and the volleyball girls, women that went into those. And so what cupping is we have actually a cupping set. Let me grab it.
Yeah.
Cupping deals with fluid changing, and it deals with so we have these cups. Yada yada. Make sure we got those.
Oh, you probably get a little closer. Yeah.
But we have cups, and so there's little vacuum things, and they have little things on the top where it's a vacuum release. So they have a valve. You can come and do that, and it puts on. So you do little things, make a little thing. You come on, and you'll come in, and you'll just have it in, and it will just suck you up, for lack of a better term. A little bit better. I'll use a smaller one. But what cupping is used for, essentially, is to draw fluid where there may be fluid stuck, where there may be stuff going. So that's a little bit better to see how it just kind of sucks it in there. Doesn't really hurt. Doesn't do anything bad. It's just in there. That's better. I don't know if that's better with the thing.
It's that one.
But it can hold in there. You can unscrew it, and it kind of pops off. But what we use these for, I use them in clinic for a multitude of reasons. Usually it's I like using them on hard to stretch muscles. So I like to use them on backs, sometimes on calves, and then periodically.
Calves, huh?
Yeah, everyone's got tight calves.
I was about to say, I was like, dang, that just already sounds hella good.
Calves are tough, but usually on these harder to stretch muscles or muscles that are lengthened for an extended amount of time.
Yeah.
So a lot of postures. If you're down like this, your back muscles are always lengthened. We try to loosen that up. So
Interesting.
we're gonna stick some on you just so you can kind of see.
So people with desk job would definitely.
Yeah, so I use them a lot of my patients that have, let's see, a number of things from like an impingement, or just like my shoulders hurt, type of thing. I slept wrong, whatever. A lot of time ties into that where you got a tight muscle or an anger muscle or something that's just a little too long all the time. Yeah. Okay. So what I have is just a little bit of lotion. You tie it around or you put it around the area just so that the cup doesn't grip your skin too much, and it can slide in and get that full. Cool. So we're gonna put a little bit just so we can see.
Slide on over.
On just so we can see it on you, the little bit of
Section.
Yeah, a little bit of suction action, just to see it kind of come up. It will create a mark. So that's the one kind of caveat you got to tell people is, hey, you're gonna have a nice little hickey on there. I would say, for lack of a better term, but that is the best term. So we're gonna take a small one. Yeah, we'll use it.
Yeah, if you're gonna leave a
we'll
hickey,
use a bigger one.
Yeah, if you leave a hickey, I want the
Make
big
one
hickey.
not a mouth size. Make it a little bit bigger. So put it on. Squeeze, squeeze, squeeze. Get a couple of these in. Bam. So for the audience members, what's the pain like on that?
Ooh,
Be real with them
probably
too.
like, this one, as it's going, like 6 out of 10 of my pain tolerance.
Okay, so it's getting up there.
so-
This is
so-
full go.
Yeah, so yeah, definitely. Whew, yeah, it's
So it
starting to
gets
go.
up in there. So that just shows you how much it can do. It pulls off like a piece of cake. So
Nice.
for therapeutic, I wouldn't be going all the way. You want it about an inch or so pulled up tops. So I usually generally go about half an inch. Okay, so therapeutic, and if I had something, I was like, all right, you actually have something here. That's what I want to do. I'm going like here and sit in that. That's as much as I'm going. Even that's like a bigger instance.
Yeah, and this is like a 3.
Yep. So the main goal behind this is science. We're going to leave this for about 8 minutes or so. See what timer. And it should feel kind of like a pulling pressure. It almost feels like a bruise in a sense. I would kind of describe it. What would you?
Yeah. Well,
Oh, it's getting pulled off a little bit.
is it? Oh shit. Maybe I should. I'll try. Won't move my mouse. There you go. That's cool.
Yep.
Say it again. What was the question?
What kind of pain is it?
Oh, kind of pain.
Like a sharp, dull, achy, like a pressure? Does it a pull? Is it a
Or
push?
definitely a pull. You could definitely feel it pulling. Like you definitely feel that for sure. I just kind of was thinking like, damn, around your other body. I think it's just where it goes. Kind of depends on the pain too.
Yeah, so I'll use a lot of the time. You have a junction. I think we talked with when Sarah was on here that point spot where I kind of was just like thumb. Bang,
Yeah.
that's where it hurts. Guaranteed. That's where a lot of the muscles fly over. That's usually where we'll put it, and it'll be a little bit less aggressive on there. Be a little bit lighter. You're gonna get really dull. Really.
And then
dull
would you
pain.
kind of line it up, or you just put one or two? I've seen like a bunch of. Like,
Usually you can go a couple. You can follow the line. You can do things like that.
oh, okay, so it just kind of following the line of the muscle, which is kind of how
so
it's
it takes a
rotated.
little bit of education on knowing, like, all right, I know a muscle's here. I know, what I got to do. And with that in it, it's kind of it takes some effort, but it's kind of hard to mess it up. If I'm being honest, it's hard to unless you're pretty. You got to be pretty aggressive with it to mess with it, or to mess it up in a way, or to cause yourself some kind of.
Yeah, I'd like figuring like you try to put so much pressure, like the first one, like full.
Unless
like, doing too
I'm
many
just like,
full,
oh guys,
like,
let's see how much of this goes.
Yeah, that's all dumb stuff you never want to do.
And so the reasoning behind it, the idea behind it is it's causing a reverse vacuum, and what it's trying to do is draw fluid from inside. So a muscle that's usually tight, tense, whatever's going on, that muscle will have buildup in it. So everyone's heard the term like lactic acid that creates a soreness.
Yep.
Your body, your muscles are natural pumps, and so the pumps move fluid in and out. And if you can't use those muscles to have a full contraction, then it's hard to get everything out of there. I like to use I always use a sponge as an example. Like if you have a sponge and you take one hand, you squeeze it, you're gonna get a lot of the water out, but you're not gonna get all of it. So what you want to do is you want to get that full squeeze, and sometimes you need that little extra twist and pull to kind of get it wrung out all the way, so get it fully dry. Otherwise, there's still going to be some residual stuff. If you're washing something and you just squeeze it and put it down, that's kind of what you're doing. So what this does is this helps gives that little extra squeeze and pulls that fluid buildup in there. A lot of time it's like blood that hasn't been able to get recirculated back, and that'll happen. And so that'll pull it to the front, and what it's trying to do is get it more to the surface where it's easier to squeeze out. Just like a sponge, when you squeeze things out, what's left? It's usually stuff right in the middle, right? It even might feel a little bit damp to the touch, but not that much. So what this is trying to do is get the water from the inside of that sponge closer to the surface, so that when you have that body basically pump, when you use it, it doesn't take as much to get it out of there.
Got it.
That'll cause looseness. That'll cause, a little bit of more stretching in the muscles. So people who are often referred to as like toe walkers. So if you always have like a forward lean, if your heel comes off the ground a little bit early compared to everyone else, a lot of time that's due to really tight calves.
Got it.
So in essence, I've had a patient before where he had tight calves. He had, went to a podiatrist, this and that, and they ended up getting him heel lifts, and that made it even worse because his calf got even shorter. And so I went through the ringer and finally was like, you know what, forget it. Let's try cupping. Let's see if this works. I've like beat it up with my hands. I've used tools. We've used laser. We've used ultrasound. We use stim. We use heat. We use ice. We've used everything we could.
Yep.
And it was a couple weeks, and I sat him down that day before treatment. I was like, hey man, we're trying everything we can. If I can't get you better in this next week, like you need to look at other avenues at this point, because I can't help you. Because I'm trying everything I can. We can continue if you want, but I'm kind of giving you this is my tool bag. I've thrown it at you.
Yeah.
So finally we tried cupping. Bam. It worked out so good for him because he just had so much stuff stuck in him, and he was the way he was walking. Anyways, it helped out.
That's
really
good though. Yeah. Because I was about to say, like, that's probably like 90% of my clientele is just literally people that are just always sitting down.
Yeah, and it's tough. So this can hang on for a little bit. So there's going to be different types of coloring that comes in. You can have the purpley bruisey. Okay, that's going to be more of deoxygenated blood. That's blood that's sat there for a while. That's been marinating in there. It hasn't gotten back into your bloodstream. It hasn't gone through. That happens because you have little capillaries, which are the vein, the little fingers that go out, the smaller ones, not the veins. They branch out into them. And capillaries just haven't been able to flush yourself back. So you have a lot of that stuck in there. Then you'd have the more maroonish or like brighter red stuck in there. That's going to be more of the ready blood. So that's what I kind of expect yours to have, is to have more blood that's already been circulating. You don't have a bunch of stuff stuck there. Your shoulder's not really like in pain or anything. So it should be more of a maroony, brighter red instead of a blue, purpley mark.
Got it.
So those blue, purpley marks are more common on places like the back or like the calf.
Got it.
Things like that, where that's just normally where stuff is stuck. So
Got it.
The good thing about this is the feeling should have kind of dulled over time.
Yeah.
It shouldn't
kind
feel
of
as
get
strong.
used to it. Yeah.
You get used to it. Your sensory starts to kind of adjust to itself. All you have to do is pull this little vacuum seal. Done.
Ta-da.
So again,
Bam.
he's going to have like kind of a maroony red, very, very apparent. Not a very...
Let's go this way. Yeah. Look at that.
So it's nice and red.
You should put a happy face, man.
Ready blood there.
That'd have been sick.
So that's blood that's available. It's moving in and out of the system. It's healthy. It has oxygen in it. No problems with that.
Cool.
You're still going to be a little bit red, but that's bursting a little bit of capillaries. That just happens. Not the end of the world. Even when you rub over it, you probably can't even tell. Does it feel like a bruise at all?
No, not really.
So that's the good thing too. At the end is even when you pull it off, it's going to look gnarly, but it's going to...
Yeah, it doesn't hurt.
Not really feel like it.
Nah, for sure.
So that's the nice thing about it.
That's
so,
cool.
Very non-invasive. You just have to be careful how hard you put it on someone. But other than that, once you're done with it, it's going to feel worse when it's on than it does afterwards.
Oh, yeah, for sure.
So
definitely. Hell yeah.
if you put it on too tight, you're going to know, and you're like, all right, maybe a little bit less. That's fine. So what we usually do is we usually leave people to their own devices at a time. So they'll go in, especially if it's your first time, I'll put it on. I'll check you in like 2 minutes. Say, hey, in 2 minutes, is it too tight? Is it okay? What's going on? It usually doesn't change too much, but some people might be like, you know what? It's pretty uncomfortable.
It's starting to get to me.
Yeah. And
It
so at
depends
that
how
point, I'll be like,
pain
all right, we can
tolerance.
reset it. I'll pop it off, put it a little bit less, check you in 2 minutes again. Still about 8 minutes total.
Yeah,
8 to 10
that's cool.
minutes, nothing crazy like that. I use it on my brothers. I use it on me. It's pretty.
You said for you said ankles? Did you say ankles?
Yeah, so
Or
I've
we're
used
talking
it
about something
on
else?
an ankle not super commonly, but I use it on an ankle if it's got just edema, so just like swelling that's in there, and you can't really figure out how to get it out. You can do all you want, but it's just you have so many little nooks and crannies in your foot from all the little bone spaces that sometimes you get some stuff in there. It's not my first go-to, but it's like I've used it before and it's helped. It's worked a little bit.
Because I was about to say, because I just sprained my ankle not too long ago too. But I mean, I wouldn't use it now because it feels
Yeah,
fine. But
if it's still swollen for a while, that'd be great. We got questions coming in.
So we have a couple questions with the regarding the cupping. First of all, Slick Fargo in chat.
Let's
What?
go.
Slick Fargo.
I'm sorry
Good
we
to
kept
see
you waiting so
man.
long.
I hear from you. Good to hear from you.
We got a few. Somebody asked, how much do these cost?
Okay, so these are depending on. They can range anywhere from about $30 to like 60 for like smaller sets. I wouldn't go for anything professional unless you are a healthcare professional. But this one that I got for my own home use was about, I want to say it was like $25, $25.99 on Amazon or something. They have some instructions that go along with it, but research, and if you have a healthcare provider, and you're seeing someone for an injury, you can at least say, hey, I have cups, where should I put them? And they can kind of guide you as you go through. I'm sure there's a million YouTube things. Just kind of be careful going into it to start it, and then gradually progress into stronger and stronger things. But yeah, I think $25.99 is like a reasonable. I wouldn't do anything less than $20. I feel like that's too cheap, and I wouldn't rely on that for what it is. But like $25.99, $30, pretty consistent to get you a solid group.
Yeah, I was actually just thinking right now, it'd be pretty hard to do it yourself on your back, but you know.
So for that,
Do they have
they have little hoses.
Okay,
So they
so
have
they
this
thought
where it
about
comes
that.
in. Oh yeah, so they
Sick.
come on in. Hey, you have extendo hosey over here.
Ah,
Put like this right here. Put it
put
on
it
my
right
back.
there, and then you already got
Put
one.
it on my back.
Yeah, I like it.
Suction up.
I'm sold.
Bam.
That was
sits
it.
there. So
That was my only other question. I was thinking, I was
yeah.
like, damn,
So
man,
they have
that'd be kinda
hoses
hard.
and things like this where you can
Sick.
kind of do it yourself. So that's usually just for the back. Again, though, it's kind of hard to like, even for me, it's like, that's the right spot, right?
Yeah, but
But
still,
you
Yeah,
can,
At least
yeah.
you can. Yeah,
It's
that's
definitely
exactly.
feasible.
At least better than not being able to do
Yeah.
it for sure.
I mean, you cup your friend cups you. It's just a cup and party. And
Cup and party.
you guys can do it
Yeah,
that way.
that's what's up. I like those. You said there was.
Next question
yeah.
we have is, first of all, Slick Fargo, we're just asking how you guys been.
Hey, we've been chilling.
Yeah, man,
We've
great.
been surviving in
Yeah.
this world, you know?
Hopefully, you had a good 4th of July for yourself, man.
Well, keeping it
yeah.
strong. Attaboy,
Yeah.
Slick.
Yeah.
And then Starlight Zara asks, does it feel like a pinch? So Timo, how was that?
I guess so. Yeah, like a really good pinch, not like a turtle bite pinch. If you guys know what a turtle bite pinch is, like where it's
Yeah.
like really super, just right on your skin. But it's just like, yeah, I guess a pinch would be a very similar feeling.
Yeah, but it's not like you're popping a pimple or anything.
no,
So it's
exactly.
not
Still
that
not super
aggressive.
small. Yeah,
It just
yeah.
feels like someone's like taking your skin and just
Yeah,
like
exactly.
trying to bring it together.
Yeah,
I
exactly.
know it sounds kind of dumb. 'cause
Yeah,
that's
yeah. I
obviously
literally
what
did
it's
the same
doing.
thing too. Yeah, so
That's
then it's, like,
obviously what it's
squeezing.
doing, but that's all it kind of feels like. You can just feel like pressure building up, and you feel
Yeah.
like someone's just like pulling
Yeah,
away from
exactly.
you. So it's not like a sharp. It's not like a sharp pain. It's more of a dull, like, all right, it's just a little too much. If it pulls too much on your neck.
Yeah, like the first one, I was like, okay, that's gonna take me. This one, like the 7, it was like really
Yeah.
a lot, intense. It was very intense, I should say.
Like right when someone hits that good spot on you, where you're like, just crumble.
yeah,
Yeah, it's kind of like that, but not as spider webby. But,
yeah, exactly. Yep,
yeah.
best way to put it. Yeah, no, it's definitely cool. I like it a lot. I'm definitely probably gonna get something for myself. now that
Yeah, I
think
like it
about
as to go around, and I honestly in my my profession, it saves my hands a lot. If I got someone who's just got like ropes for a back, and I can't, it takes like my hands take a beating sometimes
Yeah, I
to
bet.
dig into people. It helps just to be able to pull it and make it a little bit more pliable, make it a little bit more loose, makes it a little bit easier to use, and I like it for that sense. But
Yeah, it feels like it gets super deep down there too for the tough spots.
yeah, so that's always good.
Yeah.
But any more questions before we?
And then another one was, will blood come out too?
So if there's open skin, yes. So that I guess that's a precaution I should have went over. If you have like open wounds or scabs that aren't fully like healed over,
if you try to bum 'em.
yeah, there has been time where it's like broken skin. If you have like really wet and pliable skin, I've gone where I've used like tools on someone and then put the cups on afterwards, and I like broke a little bit of skin I wasn't aware of, and it brought it to the front. So it can bleed a little bit, but not like a heavy amount. But I've also never used it on an open wound before that wasn't like a scratch. But if you do,
I see what you're saying.
yeah, try not to.
Yeah, like don't. Yeah, just probably don't do it.
Yeah, don't do it over any open wounds or
Yeah.
anything. If you, I have used them outside of the healthcare field. I have used it on like bug bites before to help kind of pull out the
Oh
toxins.
yeah. I remember you mentioned that.
So,
Bug
but
bites.
I
See,
wouldn't.
on bug bites.
I wouldn't advise that for healthcare benefits. That's just me because I can't control myself scratching. So that's my own issue.
That's
not
true,
anyone
though.
else.
Gosh. I hate
But
scratching
yeah,
bug
actually, I
bites.
don't know. I don't know if you can see it, but it likes still a little bit bruised, but
Kind of
Yeah,
just takes it away.
Yeah,
It's
it takes with a bite and it gives it something to push on. But yeah,
okay, that makes
don't
sense.
don't use it on open wounds. That's a no.
Yeah,
No
yeah.
open wound stuff.
It's not pain or gain approved.
Yeah, not not pain or gain approved.
Not at all. All right, cool. I actually had a question for you because
Yeah.
I've been watching a lot of baseball lately, and I always hear about the Tommy John injury. I mean, I'm guessing Tommy John was a pitcher. I don't know the backstory.
Yes. So Tommy John was the backstory behind the Tommy John injury is Tommy John was the first person to have the surgery to repair the ligament that is torn in a Tommy John injury.
Oh, so it's a ligament that you.
Yeah. So a Tommy John injury is an injury to what's called the UCL, the ulnar collateral ligament. It's basically the MCL of the elbow. So ulnar means ulnar side. Do you remember the moniker for radius and ulna?
Some dumb.
RST. So
RST.
RST. So radius is on the thumb side, ulna is on the pinky side. So ulnar side, your ulnar collateral ligament, collateral to the side. So your ulnar collateral ligament is on the inside of that elbow. Okay, so right
right
on
there.
the inside. Okay, so that has a couple different fibers.
Okay.
So it's actually more of a triangle instead of a straight band. So it comes to here the inferior fibers, and then you have the superior fibers that kind of come up. So it's two separate fibers. And what happens when you pitch and your arm kind of trails back way,
Yeah.
it puts a lot of stress on that, and they come up and under and throw that way.
Oh, especially when you're trying to throw crazy curveballs, you're kind of
Yeah,
just whipping
and especially
your arm
the
in a weird
sidearm
way.
pitchers, or for the Giants fans, Tyler Rogers, the kind of the submarine pitch
Oh,
that comes
yeah,
up. A lot of strain gets put on that ligament, and it usually gets stretched, and it's usually a lot of training. So what happens with that is what they do is repair the ligament.
Oh, okay.
So they'll either screw it in, they'll re-sew it, they'll take
How long
another
would it
muscle
take
or
to
something.
re-sew a ligament? Like, is that,
I mean,
like,
for a surgeon, like probably like 30 minutes.
oh,
But,
really?
like,
Okay,
yeah, it
okay.
doesn't-
I was just kind of
doesn't take that long if
It's
you're a surgeon. Obviously, I'm not a surgeon.
That's cool.
But yeah, it'll take 6 weeks, probably 8 to 12 weeks to get back into like starting to do stuff, and then from then on,
You're pretty much out for the season though if you're a pitcher, right?
6 to
It's not even want to try to
12
mess
weeks
it
up to 24 to do like actual strengthening, and then from after that, you're gonna be 6 to 8 months minimum before return to sports stuff, and I think 6 is like putting it like return to life stuff.
Yeah.
Returning to throwing a baseball again is probably going to be 8 to 12 months, and that's why I mean pitchers get Tommy's John. They're just like, well, nah, we'll pack it in. I'll see you
Yeah,
next
for sure.
year. How's
Yeah,
it going?
Okay, that's interesting.
Yeah, so that's why
Sorry
it's
about
because that ligament. Once you think about it, when you throw and you come down,
Yep.
every time you're pushing that's called a valgus force coming in, and every time you do that, it's going to put strength.
You know, it actually
to
kind
put
of
stuff
reminds
on
me. So when I've been doing push-ups, I feel sometimes like I try to keep my elbows properly, but sometimes I get like a pain right here in the back. What would that be? Is it just ligament, or is it just like
Right, like here going into the
something
so
like that?
here's the
Yeah,
bone,
it
it's
feels
little
like a
up.
bone. Yeah, just like a little. It always just comes up randomly. I stop immediately after.
Yeah.
But it's always something that just kind of pops up on me, and I'm not sure exactly what it could be. Or
So it seems like it's a little bit of a it's referred to as a tendinopathy, but it's more of a tendon injury, often with increased concentric movement, so shortening of it. So the pushing up on it puts a lot more strain on that tendon, because that's right next to it's called the insertion point when the tendon meets the bone. So with a lot of pressure right there, the concentric motion of doing like a tricep extension or a push up when you're actually pushing, you get. Sometimes it could be due to an overuse injury or too much, just too many repetitions.
that's what I figured. Yeah,
Yeah,
I can
too many
definitely tell. It's like
repetitions of the
because
same
it only
thing.
goes like when I tell. Okay, it's just probably hella tired. You know what I'm saying?
Yeah.
Like.
And
Okay,
so the
makes
way
sense.
the way to combat tendinopathies or injuries like that is to create. I think we talked about. I can't remember which episode it was, but we talked about eccentric motion, which is negatives. Essentially, is what I think the weightlifting term of it is.
Yep.
And eccentrics are used to help train tendons because you're on a constant pull on them instead of pulling and releasing, pulling and releasing, pulling and releasing.
I see what
It
you're
gives you a constant stretch on it so that you can have a constant tension, and that could relay the fibers and keep it nice and flat. So that would be the only way to kind of counteract that.
Just kind of just slow it down. Just kind of have that come down. That much easier. Okay.
It's focused slow on the come down and then slow on the come up. And so just eliminating the plyometrics. Plyometrics are really tough on your tendons too. So any jumping, any landing, any.
That's why usually I try to work out as slow as possible because it feels safer. You know what I'm saying? Like especially when people are just trying to jack it up and stuff like that. Like I just from experience myself, like I've just learned that just going slower just feels better and safer. 100%.
Yeah, that's usually a good way to go about it.
Yeah.
Not for everything, but usually going slower is usually safer, just more healthy for the tendons. And tendons is really what you gotta. Tendons and ligaments are more things you gotta train. The amount of people I had a patient come in who 60, 67, 68, and she is an animal. She runs all the time, does this, does that, but she can barely hold her legs up in certain angles because she has really weak stabilizing muscles underneath.
Oh, so
so because she's so active and so fast, her big muscles just take over everything, and that's a very common thing that we see in injuries and things like that. Is just overtraining isn't the right term because like way to go, be healthy. Like I don't want to tell you not to be healthy, but it's you need more accessory training to be able to introduce stabilization into like your overall training program, especially when you get to the older age too.
Especially rest.
Yeah,
you need to
I don't
rest.
care if you can run 15 miles and you're 70 years old, ladies. Like it does not matter to me. If you want to do it, cool, but you better like make sure you can like balance on one leg for more than 30 seconds. That's kind of important.
Yep. Especially when you're older and your sense of stability is already off, anyways.
Yeah, false.
Yeah. I've always heard well, and I haven't always heard, but I heard that walking backwards helps a lot too. But I don't know. I don't know if it's just because like it's the opposite of because everybody's always walking forward.
Walking backwards could.
What would you say the good and bad would be if there was a good or bad?
Bad news is you can't see.
Well, let's say treadmill because that's what I've actually been doing. And I feel because I've always been trying to just. Oh,
you're good. It's empty.
Oh, cool. But yeah, because what I've been doing is because I play basketball, so I'm just anything that I've kind of whatever feels good from my knee. So, now that I'm older, because I'm always jumping up and down, doing anything like that's kind of helped warm up my muscles in a sense. But I wouldn't know if I'd like did a full workout walking like backwards and stuff like that.
So that would be good for your. I would say that's a solid like patellar tendon training type of thing.
Yeah, I usually do it
quad killer.
Like an incline. On an incline, I'm walking backwards.
And again, it's slow, it's safe. I'm trying to think of a reason not to. Actually, I don't really have a reason not to do that type of training. It's just annoying, and a lot of people don't like doing it. So I don't think I've ever had to like be like, don't do it.
Yeah, because I mean,
people just
necessarily because even in basketball, I'm backpedaling and moving. So it's already a motion that I'm already kind of doing. So, but I do enjoy it as a warm up. It's a little different too because you're just like walking backwards on the treadmill. So it's something. It's switching it up. Yeah, so I'll go walk forward. I'll go sidestep for sure, and then I'll just walk backwards and sidestep the other way. Just literally full circle.
Yeah, I would say it's a solid tendon training.
Okay.
Whatever you can do to
feels
have
better. Definitely feels better.
Constant pressure on the tendon without having to pull it excessively too hard. Like jumping where it relaxes and it contracts and it relaxes and it contracts and it relaxes and it contracts. That pulling at the bone essentially at the bottom part is not the greatest thing. What can actually happen is you can actually literally lift up that bone where the knee is connected with, and then you can have more bone filling under it.
Got it.
So if you have people who've been like, yeah, I've always had these bumps on my knees, and it's like right around their patella, right underneath their kneecap. A lot of times it's a, I don't like saying it's a disease. It's referred to as a disease, but it's like a syndrome called Osgood-Schlatter, where it's literally you're usually from teens, I guess, in like 14 to 17 years old. Too much jumping, too much
really
sports like that, where it's a lot of plyometric stuff where their tendons will start to pull off a little piece of their bone with it. And then bone will fill underneath it, and then it'll have a little bit bump. So next time you use it, again, it'll pull up a little bit. And then eventually you have this nub of bone underneath.
It's interesting.
And it can get really painful. and
I
it
bet.
causes some like quad weakness and stuff just because of how it's sitting. That it can get bad to a point to where you could have surgery to have to reattach it if it gets too far. But I haven't seen too many surgeries come from that. I'm trying to think
But
of any that I've
that's
had, but I've
actually
definitely had
kind of
plenty
crazy
of like
to think
adolescent
about
patients.
how your body could actually do that too. It just fills it in more and more and more. And oh my god.
Yeah, your body can it adapts. So that's probably the hardest thing to get people to understand is your body will adapt to things good and bad.
Mm.
And so when they're like sitting at this for a long time, be like, yeah, your body's gonna adapt to it. It's not gonna be great, but your body's like, hey, that's where I'm at. That's what I think is gonna be my future. So I want to make the most out of it.
Yeah, I've actually been telling a lot of my clients to be like, hey, you know what? Set a little timer on your on your alarm or your iWatch and just like get up and stretch. You know what I'm saying?
something.
Because you got to do something different. Because if not, like we said, you're just gonna get used to it. Got to do something. Switch it up. Take a quick walk. I don't know.
Yeah, and that's like tough too. I understand, especially all
Especially
the
when you're
people work from
locked in,
home now
yeah.
too. It's like
You're locked in.
you can tell them, yeah, set a timer for every 30 minutes and get up and walk around with your laptop or whatever. But like, is it realistic? Is it feasible? It's tough, man. And there's a lot of things in the real world that I try not to talk to patients about because, well, I talk to them about it, but understand that like life don't stop, man.
Yep.
Life don't stop for anything. Just like you've had your recent client that had like she got personal issues. Well, you're not seeing me for 2 weeks.
Exactly.
Or whatever
Yeah.
it is.
you're
Like,
just- so we
you
have
got to take care of that. Like, I'll have people who will be like, "Oh, is my daughter calling? I got to take this. She's taking care of my grandma. I don't know if it's an emergency." I'm like, "Yeah, man, take the
Yeah,
call, man.
yeah,
You got
come on,
stuff to
dude.
do. It's fine."
yeah.
So that's when I tell them like, "Hey, I would try to do these exercises 2-3 times a day. I get life happens, but try to do whatever, or like sleeping." I think I talked to you guys about that. I hate telling people like to change their sleeping habits because it's so hard. You can't just like
No, especially if you've been doing it for so
let
long.
me fall asleep real quick, piece of cake. Like that doesn't happen. I can't stand talking.
I always
to you about
recommend naps, but it's so hard to get a nap in. You know
well,
what
yeah,
I'm
like
saying?
you can lay down for 30 minutes, but like you actually going
30
to
minutes
sleep is
though.
like
Yeah.
I don't know how long you're gonna actually go. Like when are you gonna actually fall asleep? I don't know. Like oh man, I was just falling asleep. It's 20 minutes in. But yeah, there's some things like that I just don't like talking to patients about.
So we got a question from Starlight Czar. We got quite a few actually we're gonna go through, but this first
Hit me
one,
with them.
I feel like I have a weak core, and that's contributing to lower back pain because of how I sit. My head hangs a lot. My back is curved when I use my laptop phone. Does anyone have any suggestions?
Hold on, that was a lot. Where is that? Let me read it.
Basically what we're talking about, just from sitting for a long period of time, hunched over. Yeah, pretty much that, just kind of thing.
Well, sorry about that, guys. Yes. Weak core contributing lower back pain. Head hangs a lot. Back is curved. So there's a very common thing going around called forward head syndrome. It can lead to headaches too, in a way. Sometimes migraines. But that's usually migraines induced from the headaches that it's given. So not directly, but secondarily. What happens is because you're hunched over and you're falling back, your head needs to come forward to kind of offset the gravity. So you try to put your main core backwards. You try to lean forward so that you can be more focused over center and to kind of look up at whatever you're doing. So what happens is you have cervical flexors and extenders, which is like your upper neck.
Yeah.
Then you have something called your capital flexors and extenders. Capital is just the base of your skull on top of your top vertebra.
Mm-hmm.
And so what happens is your cervical flexors, your neck, goes forward, and my capital extenders go up.
So you're already kind of like up.
Exactly.
You're already in
So
a
you do that
weird
little, like,
position. Yeah.
chicken.
I see what you're saying. Yeah.
So that's what happens for an exaggeration.
Yeah.
What happens is your capital flexors attach to the base of your skull called your occiput.
Mm-hmm.
And that occiput has a bunch of connections onto it, and they have nerve endings that are related to what's called cervicogenic headaches.
Mm-hmm.
Cervicogenic headaches are kind of the ones that come around like a band, that come around the temple where you just feel it like pressing against your skull.
Oh, you know what? That's funny because my client was asking me about this. Literally, she's like, I don't know. Sometimes I just always just be getting headaches, but so now I can tell her.
So sometimes it could be related to that. They have things where you could lay on things for occipital release, and they have pressure points in there. But all they're trying to do is trying to stretch out your capital extenders because they're tight from doing this, and try to stretch out your cervical flexors because they're tight from leaning forward.
Got it.
Okay, so your
It's super just tight all up in here.
yeah, so it causes your neck extenders, okay, to be on tension the whole time. So if you got something on tension all the time, doesn't always like that. So like imagine like you let your knee hang really straight, like your legs really straight for a while, and then you try to get up after it's just like
Just been sitting
hanging
there.
like that. And you're like, oh my God, this takes a second for my knee to even like get
Release,
back
yeah.
where it is. I don't have any knee problems. What happens is when you have muscles or something on tension for too long, they pull on both ends. So the origin and the insertion point, so where it's connected at the top of your skull as well,
Yeah.
and where it's connected, how it goes like a giant triangle,
Yeah.
kind of down to your mid back, down to your spine, around to your shoulder blades.
Yeah, all the way through.
Those get really, really annoying. So those do not like to be pulled. So that also leads into pulling at the base of the occiput, which also is again cervicogenic headaches where this is happening. So
Yeah.
not only something really tight and always flexed, but the other one that's on stretch is just pulling the whole time. So anyways, that's what's going on with the upper body and neck. Your body just isn't used to doing upright sitting for a long time. So you have something called your transverse abdominis, which is like a corset for your stomach, I guess, for lack of a better term. For your, it's called your thoracic cage.
Yeah.
So right underneath your ribs, it's like a band that comes across. In order to sit up and to keep it tight and keep everything in motion without your spine kind of moving, you need to have that activation. So it's a lot of how we kind of were talking about earlier is stability. So being able to sit up for a little bit and just recognizing what's happening. Because you're just
Yeah, because you're just
built to do
relaxing.
that.
Yeah, you're just kind of relaxing after a while too, especially when you sit down.
Your body's built to walk, it's built to move, and so
Yeah.
kind of sitting down for an extended amount of time is really hard for your body to understand, like, oh, I need to activate these things.
Yeah.
Because you can
Posture up.
relax so much with all this that it's not like, well, I need to keep these specific stabilizers activated. Like, that's not how your body works. So in order to kind of keep it where you want to be more of active is less leaning back and forward and more of kind of upright and more of like a lower core activation that will keep everything else in line, that kind of shoots up the chain in a sense.
Yeah.
To just kind of get that little backwards tilt, get a little bit more of
It's
that
kind of be
back
just a little bit more
lumbar bend.
self-aware of kind of how you're sitting in a sense.
Yeah.
Because you kind of have to remind yourself like, oh shit, let me
And so that's what I talk with people about lumbar stability. So they have the lumbar cushions. I don't like to use that as like a cushion. I like to use it as like, if I'm hitting that, I'm slouching.
Oh.
So I like to have something behind me, so which gives me like a little reminder. So if I'm like leaning forward and I'm sitting in an appropriate posture and I start to do this little like drop and I can feel it against my back and I'm like, oh, okay, I need to get back up a little bit.
Okay.
And maybe not like this extreme, but if I'm like sitting back normal and I can feel it and like, oh, my mid back hits it or my lower back hits it, then I need to kind of like go upright.
Yeah, I
But
see
you're
what
going to
you're
get tired.
Yeah.
And so you're going to have those times where you're like, all right, I need to like lean back and relax a little bit. And then you're going to get back up again. And again, when I slouch down and my back hits that pillow, that's when I'm going to kind of come back up again and be like, all right, I'm hitting that thing. And it's not going to be right away. It might be you're sitting here, you're typing, you're doing your Zoom meetings, you're going through things, you're blah, blah, blah. And all of a sudden you take like a breath, you're like, and you're like, oh crap, my back's touching. And then you can get up.
Yeah, just a self-awareness of like, hey, yo, check it out. Hey,
Yeah,
hey,
and
check
that
it
bottom,
out.
as long as you work from the bottom up, everything will kind of, because once you do this, you're not going to sit here and still do this.
Yeah, because then you're kind of,
Yeah, because then you're going to get up and you're like, oh, let me think about the rest of my body.
Yeah.
Obviously, this isn't right.
Yeah, exactly.
So let's get back, pull the shoulders back. And so that's
So,
a
but
good
it's like a
reminder.
slow. Yeah, that's pretty cool too, because it's like you slowly over time, your posture will just get better. You know what I'm saying? And it's nothing too hard to do. You know what I'm saying? You just need like just a quick reminder.
A little
you know?
push.
Yeah, exactly.
Okay. We got more coming in?
So I got more. This is an interesting one from Slick Fargo.
Ooh,
He
hit me.
asked if we talked about the UFC injury. I guess Tom Aspinall had an injury. If you guys haven't seen it, I actually have it pulled up. You guys can watch it right now.
Oh.
Okay.
All right, you guys get it over there. All right.
Oh, okay.
You guys can see it on the stream. Ethan.
All right.
We'll be a little behind on the delay, but
And let me 1 second. I think they showed it in slow mo.
Let me see it. It's probably gonna be gnarly as hell because it's UFC injury.
So, what did you think of that?
After. Okay. Oh. He kicked him, broke his shin, and he stepped on it. Oh.
Oof.
Oh, because he kicked him.
On that right leg?
Yeah, right leg. Boom.
Oof.
And broke it. It looks like he broke it, I guess. I don't know.
Oh, so did anyone come out with what actually happened? That looks like it could have been a, was that a step back?
Because you can't. Actually, it happens a lot. I've seen in UFC that they
Yeah,
kick.
so what happens? Yeah, go for it. I think you're on the right track. I want you
Yeah,
to
they
say it.
kick their shin or whatever, just hits them right on the money of the other person's, big leg, and it just hits a sweet spot, and it always just bends bends like this. I guess I should do it, but it bends, and when they step back on it again, they put all their weight on it. That's when they always fall down. I think Anderson Silva had the same thing, but I could be wrong.
Pretty spot on. I think you had it. You just didn't bring it home. But what happens is he makes contact.
I'm not a doctor, damn it.
He makes contact, and that will cause enough of a fracture to where it won't fully your muscles and everything, because you're still using them when you're kicking. Your calf is flexed. Your anterior tibialis is flexed. You got all these flexing muscles holding the bone in place, so when you kick and make contact, that it tenses up. So you crack it, and then when you come down to step on it, and some of those muscles release, and you step down onto it, then it bends and it fully breaks.
Oh.
So I don't know how common knowledge this is, but a fracture is a break. Any fracture is a broken bone, and your broken bone is a fracture. Same thing. Fracture just usually referred to non-displaced.
Yeah.
Which means there's a crack in the bone and the bones are both together, but there's a crack in there. So a lot of times what happens, especially in UFC fights, you see it a lot more when they come in and they kick and they get like, I can't remember the term, but they get pinched between the elbow and the knee. And so that will actually crack the bone from both sides. And then once they go to step on it, it'll finish the job basically. So that's generally what happens with it. From what I saw with that, I could be wrong. A lot of the time it's kind of ligamentous injuries too, where you tear it. So what could have also happened is you hit it, and everyone knows your ACL.
Yeah.
So your ACL controls your tibia, so your shin bone, from going forward. Okay, so what the PCL does is the opposite. So the PCL controls the tibia from going backwards. So what could have happened is if he kicked hard enough and that shifted back quickly, could have tore the PCL, and then he went to go step on it, and then it went too far backwards that he hyperextended his knee or whatever, and then couldn't kind of balance on it. That's also something that happens very, a lot more rare than just literally breaking a bone.
Just all the way through.
But that's something that could have happened.
So if you fractured it, how long is like a rehab for a fracture like that?
Depends on surgery or not. If it's fully displaced, whether they got put like rods or pins into it, but to get back, you're looking at least 4 to 6 months.
4 to 6 months.
Yeah.
To fully be
if it's
healed?
fully displaced and he has surgery on it and it is a full broken bone. If it's a PCL injury, it's going to be surgery. It's probably going to be 6 to 9.
6 to 9.
Nice.
But fighting, for UFC, I wonder how much longer it would take, because they kick with it all the time. You know what I'm saying?
Yeah. So that's where it kind of goes in, where this would matter more or less in your prospective sports.
Yeah.
Take that with a grain of salt. I could be completely wrong on that. That's kind of generally what I've known for mine. I don't work with professional fighters.
Yeah, no, it's probably different. Yeah.
But that's generally kind of the time frame we would have for that. If it was just a fracture, not a full break.
Yeah.
Probably 10 to 12 months before you get kind of returned to stuff. Probably, or 10 to 12 months, 10 to 12 weeks before you return to everything. Probably 24 to 36 weeks before you return to contact. probably up to 48 weeks to get back into full things.
Yeah, that's
So,
crazy. It just hurts looking at it.
It could same thing be 3 months before you're actually fighting again. Again, I could be completely wrong. I don't work with a professional athlete or with professional like fighters. And stuff, but
it's different.
Danny also said that that's actually the back-to-back event that guy got injured.
Oh.
So shoulder popped out, and now I guess he said also there's no official word on yet, but of course it's assumed it's a knee injury on that.
Oh,
could have been the PCL. I don't hope anything, but like it could have been the PCL.
How you're saying where it came backwards?
Yep. So when you try to step, if you hit that and it shifts your tibias too much and it breaks them.
And then it said, "Oh, damn."
Yeah. So.
Dang, back-to-back fights, man. Sheesh, poor guy.
And then we got a question from 50. He asked, what workouts and stretches are recommended for lower back? I might need names of some forms to get my back right.
Okay. Yeah, that's good.
Okay. So from lower back stuff would be I don't really like giving people like pure back extension stuff. It's kind of tough to do and it's not for like pain wise, but usually back pain stems from a spinal instability. So like quadrupeds, bird dogs, you heard of those?
Quadrupeds and bird dogs.
So if you're on all fours, hands and knees, you put one arm straight up in front of you, still looking straight at the ground, and your opposite leg.
It's sticked out.
Yeah, so one leg up,
this.
put it down, one arm back down. You do the same thing with your legs, one on while you're on all fours, trying to keep your kind of
core
back
engaged and short. I can see what you're saying on that one.
There's another one that I kind of like to do for more like a stretching one is you take like an exercise ball and you kind of like just lay over it, and then you have one arm on top, kind of like just engulfing, kind of like you're just stretching out your back. And then you do the same thing over that, is where you put one opposite arm, opposite legs, your left arm, right leg, or right arm, left leg, and you kind of put those up and try to get them straight with your body. I like to do those as like stabilization things, but pure back strengthening's tough because it's really easy to hurt it if you're not prepped for it. But the transverse abdominis, that's a big core muscle you should focus on while you're doing that. But simple, slow things and a lot of things where you're holding it in the air for a while. So like
but just
bicycle
keeping
kicks.
Extended. Okay, yeah, I know.
Yeah, so you can like lay on your back and then lift both knees up and then do the bicycle. Just have one at a time going in the air. Keep the back tight. Try not to get your back arched as you're doing it. Try to keep your back flat. Keep your core tight, and then you can go from that. And you can put one leg out and almost make a one leg 6-inch. And then bring it back in. Let the other one come down. Bring it back up.
So just more of this, like you're saying, the stabilizing and just kind of keep it going.
Yeah,
like,
I would focus more on core stability instead of like purely back. If you're having back pain and you came in 99.9% of the time, I'd probably give you core stability stuff.
Yeah, like would you?
Because your back works hard enough as it is.
Yeah. So like, would you go into like a full routine of like a core workout, or just kind of?
I'd have about 3, maybe 4 of core stability bases, and then progress all of those into like training exercises.
Yeah, more movement based.
Yeah, start with just like the transverse abdominis use, squeezing it, and then from there go into, all right, we're going to lift one leg up at a time and like march. And then once we can do that, we're going to kick one leg out, kick the other leg out, and then we'll go into bicycle, and then we'll do bicycle with one leg coming out, bicycle with the other leg coming out. And so we'll progress into that.
I always have all my clients do 6 inches. Would you recommend 6 inches?
As long as you can keep the back from kind of really arching, because a lot of times 6 inches, what they'll do is they'll keep that back from arching so that their ab can kind of, it's just on stretch.
Got it.
And so it's harder to...
as long as their back is flat in the sense of just keeping your
back
flat.
You don't want the...
How do you feel about people putting their hands underneath their bottom when they kind of do stuff?
So
but it's cheating, but is that still like a safer way to kind of like start off?
To stabilize it, yeah. So the problem with that is when you tilt your hips forward, your ab that's in front gets longer.
Got it.
So what that'll do is when it's longer, it's easier to use.
You got it.
So what they'll do is they'll do that kind of turning down, lengthen their abs. They don't have to use it's called your iliopsoas muscle.
Okay.
It connects from the inside back
all
to
the way
your
through.
hip. And that a lot of the time is really weak. So when they do things like that or do the leg lifts where they're just kind of like their just
Going
back
forward,
looks
yeah,
like they're
yeah,
lifting
yeah,
up
exactly.
off, that's because they're locking their actual hips and abs and they're just using their backs to do it.
Got it.
And so
Yep.
I would just as long as we're cautious about keeping that
Back flat.
yeah, as long as
Gotcha.
we're cautious about that, then
It's okay.
yeah,
Cool.
I like it. I support it.
Yeah, I do a lot of stability core workouts with a lot of my. I feel like that's the best place to start. I mean, honestly, even from my origin story, the trainer Mario.
Yeah.
That's the first thing you said. You said you guys should just train core. It's everything. Core is everything. But yeah, hopefully, you get to try that 50. Try some little core exercises. Nice little stability. Do we have another?
One from earlier. It was what is the most taxing sport to play on your body?
I will guess football because you get hit all the time. You know what I'm saying? Like I feel like because you're always thudding and getting beat up in one way or
So-
another because you're still being active as well.
Yeah.
That would be my guess.
Kind of unpopular, maybe not unpopular, now popular, I guess. Racing.
Whoa, really?
There's only so many people that can, one, tolerate the amount of pressure and force that it puts on your body, but to be able to still perform almost like, I guess I would say like jet flying if that was a sport. But to be able, there's a very like
that's
select
interesting.
percentage of the world that could perform that quick reflexively to be fit enough to perform said reflex under the immense different like pressures that they have in F1. And I recently learned about this. I don't watch F1. I don't know anything about it. I don't know anything about I didn't watch the Netflix thing. I have a lot of friends that did. Heard it was great. You should watch it. Cool. But just understanding when I was in school, looking at a bunch of different types of therapy and training, and we got to balance training and reflexive training, that was one of the big things was they showed us was the people who have wings. I don't want to say brands or anything. The people who have wings, they're training for their racing, and they had these wild they'd be spinning you around in a centrifuge basically, and you'd be having to like try to drive while you're having all of this forces come back on you, and those turn you other which ways, turn you upside down. It's almost like astronaut training in a way, and it's very to be able to make that much of a decision when your body's under the amount of stress that it is with all the pressure coming down. I think Lewis Hamilton just had an interview where he was like, yeah, we lose like 7 pounds every race just from fluids.
That's crazy.
Like that's wild. And then they're like, yeah, if I had 7 pounds to my shoulder, it throws it off. I got to work so much harder on my hips. And so the amount of training that they do to be able to do that, maybe not damage on your body, but just like the fitness, I guess you have to have for that is out of this world. It's obscene. Other than that, maybe
cool take.
Maybe MMA fighters because you just punch each other in the face for a living. That kind of sucks. But
there's that too, I guess.
But yeah, I would say F1 racing is maybe not the most, but definitely the most underrated amount of like fitness level you have to have, and like the amount of just athlete you have to be. Because you think about how many players are in the NBA, hundreds.
Mm-hmm.
Like there's like
True.
30 people that can race, and maybe like 10 of them are any good in the comparison of everything else.
Yeah, it all breaks down. Yeah, for sure.
Yeah,
That's
so
interesting.
That's
That's
kind
cool
of
take.
wild to me.
I like that.
Yeah.
A couple things here. First, like Zara said, when you say core exercises, do you mean like planks?
For me, planks would be higher level than.
It's pretty.
Yeah,
pretty
that
taxing.
would be moderate. That wouldn't be like a beginner thing. So if you like have a strong core, we would try it, and it would be something we would train. I've definitely given it. I've prescribed it as, home exercise.
It all
program
depends
and
on
stuff before.
X, Y, and Z, of course.
But a lot of the time, if you're seeing me and you can do like a minute plank, you probably maybe don't need to see me anymore, type of thing. Yeah, I've definitely given people plenty of planks. It's usually on the end stage, like, hey, try doing this. If you do this, see me in 2 weeks. Let me know how
There's
you're feeling.
one that I always see that it's like super beginner. I don't know if it would still work, but man, I just missed it off the top of my tongue. It's a floor bridge, if I'm not mistaken, where you put 2 feet and you just lift yourself off.
Oh yeah, on like
Is it a floor
an
bridge?
exercise ball or something, or
Actually, just on the floor, just kind of lifting
Interesting.
yourself up. Just and you're like in a 45 degrees angle.
Oh,
If your
okay.
head's there. I think it's called a floor bridge. That was one of the things that was on my
Yeah.
list for beginners and stuff. Like super easy. You're kind of engaging your core, but I don't know.
Keeping it tight. Yeah, I
just
give a lot
going
of
up.
sliders.
Sliders.
Just like we done the sliders, you can do sliders, you can do mountain climbers, you can do planks on it, you could, do arm circles with it, and you can just mix in a plank. A plank to me is kind of just a base for doing a bunch of other stuff with. So if you could do a plank, sick. Like that's a good, very good starting point to be. And if doing a minute of a plank gets easier, there's 100 ways to make it tougher. And
Yeah,
so you should be able
that's true.
to get yourself tired within a minute of being in a plank by doing something.
Yeah.
So I love core for plank stuff.
How do you feel about crunches? It's like non-essential. It's like don't even.
I can't say I've ever prescribed it. It's
Yeah,
just
I've never.
not.
I don't
it's
even
not
have people.
important.
I don't have people do crunches
Yeah,
either.
the muscles that you need to do it are kind of show muscles. They don't really matter too much. I care about what's underneath. If they want to go look better, that's cool. Like more power to you. I don't care. Go for it. But I'm never gonna prescribe someone crunches as like a.
Core exercise.
Yeah.
I mean,
I'd rather do the bicycles. I'd rather do the marching. I'd rather do the
6
quadruped.
inches.
I'd
have
rather
them
do
6
planks.
inches.
So there's a million other things I'd rather do than that. But if you want to do it, I'm not going to be mad at you.
Yeah.
Go for it. Do whatever you want to do.
The next question, so Fargo actually asked, what happened to the marathon?
Yeah, it's a good question. I actually had to work. I had a coworker, and she's, we'll just say interesting. And she didn't want to cover it, so we weren't able to do it. So we weren't able to sign up.
We'll have to find another.
We would definitely find another one for
another
sure.
thing I can walk for 3 miles and drink a bunch of beer too while talking about people.
Yeah, we could definitely do that.
I'm not too crushed, as you can tell.
Don't worry, we're
by
still
that
gonna make this. We love Slick Fargo
We'll
shirts,
do something.
and we're gonna go on.
Oh
the
yeah,
marathon.
I love Slick Fargo shirt no matter
Yeah,
what.
don't worry, man. We'll have it. We'll
You
figure it
just
out.
Do your own marathon, just run around.
Just what?
downtown.
Just do it downtown.
Real
Yeah.
Painter Gang marathon.
There you go.
The Painter Gain
Anybody want to
run around the Giza, just going down the strip.
There you go.
Oof.
Yeah. So that's what happened. That would have been
I
fun.
like
for
hey,
sure.
he's keeping us accountable, so we need
Yeah,
Slick Fargo.
actually, but you know what? I did train like I was still gonna go for it, so I stayed on pace. So I'm ready. Definitely ready.
I did not. I had a barbecue this weekend, therefore we did that.
No, actually, it was actually pretty cool because I'm kind of glad that inspired me to kind of really work my like long distance kind of running and stuff like that. So I've been doing pretty good. I've been going. I go up I increase it by 2 minutes each week. So I'm up to about like 18 minutes now. So kind of cool. A little slowly progression because I play so much basketball, so I can't really be doing it for too long.
Oh
Yeah.
Danny said that's a beer crawl, y'all.
A beer
Yeah,
crawl.
that's exactly what I was gonna make out of
We
it.
could
I
do
don't
it.
know if anyone thought I was gonna do
Yeah.
anything. Yeah, I was 100% walking that with like 3 different beers,
Yeah.
one a mile. I was hitting a beer a
We
mile.
could have
that's what
like
I was hitting.
I actually seen a beer belt.
Yeah, no, 100%. That was me. I'm gonna be. I
Let's
would
get
have
a
been
beer
doing
belt.
that instantly.
And then
Yours
Slick
could be.
Fargo-
Oh, okay.
And then Slick Fargo said, I hope you guys still do one. So we're going to have to plan one. We're gonna
Yeah,
have
no,
in.
yeah, we'll definitely will for
Keeping
sure.
us accountable. I
Hell
love
yeah.
it.
to check it out.
Oh,
Yeah.
I was doing some good old community work at the local at our old high school, our old soccer
really?
games. I helped do we did like 140 physicals or something on
What?
some kids. Yeah, it's too many.
I was like,
But,
that's a lot.
Yeah, no, we
That's
did a
cool,
bunch
though.
of physicals for them.
That's pretty fun.
Try to get that down.
Yeah, get all the kids that are ready to play some sports.
Got to listen to a couple heart murmurs. That was fun. I don't really get to break out my stethoscope very often, but we had my coworker, I don't even know what to call him. The chiro I work with, he does the cardio stuff, and so we had a couple people with just like really. We had two kids with really distinct heart murmurs, and I have a stethoscope and I know how to like listen to breath sounds and still do those things, but I haven't really done it since school basically because it's just not.
You're not always practicing it.
I'm in an outpatient orthopedic clinic. I'm not really listening to heart murmurs on a daily basis, so it's pretty cool to hear those. I'm like, oh yeah, this is like what a real heart murmur sounds like again, instead of like on a dummy.
And what would be what's a heart murmur?
So a heart murmur is basically if there's like what's the word? So it goes like you have different valves, and so
Yeah,
it's
yeah.
like almost like a mini defect in the valve, to where the valve will go up and down, and then it'll be like a backsplash a little bit. So you'll hear it go
Oh.
boom boom, shh, and it'll be like a little whoosh. And so
Okay.
it sounds pretty cool. I mean, it's not cool for people who have it, as long as it's like asymptomatic. Both of the people didn't have any issues from it. It's been monitored from a young age.
Oh, so okay, it was already previous.
Yeah, but like that was pretty cool. There's something called the tetralogy of Fallot, and that's like a birth defect. I'm trying to think. There's 4 different things that happen into it, and it's just like the big storm of crap that happens to like as your heart's forming when you're a baby. It does a bunch of twists and turns,
yeah.
and because you don't have oxygen, because the lungs and stuff, you don't have oxygen in there. You don't have to differentiate oxygenated from deoxygenated blood, so it's just like
I see what you're saying.
1-2, sending it back into the
Yeah, because
entire body.
it does twist. Now I'm
And
thinking
then
about
so
the diagram.
as it forms, it starts to twist, so it can differentiate lungs and the deoxygenated blood that
Yeah,
has to go
yeah,
through the
that
lungs
goes
to
the
get
other way.
back, and then it goes back to that stuff. But anyways, that can sometimes leave you with a murmur if you've had like surgical fixes with it and stuff. But anyways, yeah.
Yeah.
Long story short.
I actually have one for you. Danny in the chat was saying there's one that's called Rock and Roll San Jose.
Oh, Rock and Roll San Jose? What?
October 8th and 9th.
Oh, okay. We got to do the 9th because 8th I sporadically just or just I don't know, or spontaneously just bought tickets to an event.
So on the 9th, it's going to be downtown,
Okay.
right?
Oh no.
And I'm actually
looks-
going to tell you
it
guys
looks
the,
huge.
What the route is. All right, so it starts over there on Market Street downtown.
Okay.
Okay.
It's not bad.
It goes south. all
I've
the
heard of the
way
Rock and
to,
Roll
like,
Marathon.
Under the freeway.
Okay.
You make a left, and then you go all the way down 3rd.
Okay.
All right.
We're not
How
too,
long
we're
is
not
this
too far.
marathon?
Then
Not
you
too
go-
far, not too far, not too far.
I'm not even going to tell you the length of it, but then you go right on Santa Clara. You go left on 13th.
Oh, whoa.
Then you go all the way down to Heading.
Whoa.
Then you come back up 2nd.
For why?
We're doing like tag teams here.
Then you come across like
relay race?
This is long.
Say you're back on Santa Clara.
Man,
Take
shut
it
up,
out
Danny.
here the whole way, like all to past the Whole Foods, past the, and then basically come back around and come back to
What? Rock
Shut
and
up,
roll?
Danny.
the park. There's like DJs, they have live events after the finish line. So hey, you guys gotta do
Sheesh.
it, walk it, run it, do it for.
That
Slick
sounds like.
Cargo.
Shut up, Danny. 13 miles, man.
13 miles?
Yeah. We gotta tag. We gotta make a collective "We Love Slick Fargo" shirt, and then we gotta like
Just keep on
You're
passing
next.
it. You're
Yeah.
next. All sweaty.
we're gonna have like 3 of us just in like a golf cart with a bunch of beer in the shade, driving next to the one guy
Rock
who's
and
like
roll. That's what
outside.
they call it. The rock
You know
and
what?
roll.
That would actually be kind of cool to baton pass. So somebody starts it, we'll all be waiting there past the
I would say a hat, but I don't know what's worse, like getting a sweaty hat or a sweaty shirt from someone.
sweaty hat.
Hat.
Yeah.
Nah, sweaty shirt. How sweaty is the shirt?
I don't know. It's 13 miles. You tell me.
That's true. That's soaked.
It's a soaked shirt. Whoever's last is just not even gonna put it on. It's gonna hang it over
Yeah,
his shoulder because it's
They're just
so gross.
we gotta carry it as like a flag. Everyone's gonna be like, "What's wrong with these guys? Who are these people?
Sheesh, 13
Who is-
miles.
Who the hell is Slick
Oh,
Fargo?"
I'm only like at 2 miles, barely at 2 miles. That's nuts. Yeah, we'll think about it.
I definitely see a shortcut. We're just gonna walk.
We're just gonna like break off and
Right
just
through
like
the
come here
ends.
to your house and just like chill and then like pick
Yeah.
up. Off
we're gonna hit like in The Office where they do the he's like carb load, and then the 3 guys just dump off into the taxi to go eat at like a restaurant, have some wine,
Yeah.
and then get dropped off by the finish line.
That's dope.
Oof.
I'm down for that.
Shut up, Danny.
13 miles is nuts. Yeah, but we'll find one. I don't know. We would have to train all.
We'll see. We'll see about that one.
He was like, nah, do a real marathon.
Man, I'm trying to
Real
get
bro.
back to like a. Is there like a Santa, like a
Like a
Christmas
Santa cruise?
No, like a Santa 5K or some crap like that, or like an elf 5K.
Santa Claus?
Yeah.
He wants to wait until December. He's
Where it's not
"Give me
gonna be
a
hot
chance."
as hell.
Oh.
Hoping for rain.
October is kind of cool though.
Or like in
October
October,
should
I'll
be
do
alright.
like a boo 5K. I don't know. I was trying to think of a pun with boo and 5. It didn't work out. very
Boo
well,
5.
but the bouquet.
The bouquet. There you go.
No.
The bouquet.
Well, 13 miles.
We
is
gotta make a
tough.
bouquet. We'll just make our own.
People train for months. Yeah, shut up, Danny. Look at me.
Yeah, we'll
I'm
definitely
the
find
captain
something
now.
though.
We'll figure it out.
Yeah. If the one in Big Basin is not supposed to be that big, but it's just kind of going uphill and downhill, which that'd be kind of cool because you're in the trees and stuff like that. It's
That's
in
true.
September.
Or like a Yosemite one.
Yeah, exactly.
Yosemite. Hey, yo, all the fires up there.
It started again.
Yeah. Well,
Oh,
my
no.
boss was telling me the other day about a couple big old fires. He has like an old friend that's up there.
Oh man.
Anyway, shouts to you guys if you're over there. Be safe.
Yeah, for real.
Dope
sheesh.
internet if you got it. Screw Danny. We got any other questions? I want to get off of that.
Pissed me off for that.
All right.
Dude, shut up,
Here's
Danny.
the real debate. This is from first time chat viewer.
Oh,
If Mick then.
Hey,
This is the real debate.
shout out.
Do you wipe or do you let it crust? I don't know what he means. I'm gonna let you guys go ahead and decipher that how you like.
Do you wipe or let it crust?
I'm assuming this is sweat on the hat and or shirt that we would be passing. I'm kind of a crust guy. Just let it roll.
Just let it crust.
Yeah.
I'm gonna just
Wipe
wring it
unless
out.
it's coming in the eye. If it ain't
I'll
getting
just wring it out.
if it ain't hit me
all
in the eye,
gross.
like it ain't my problem. As long as it doesn't make my eyes burn, I don't care where it is. Like it normally stays.
Yeah, no.
I'm down for letting it crust.
No, I'm gonna wring it out and wipe.
All right, I respect it.
Just let it
I'm a
get up
just
in there.
protect my eyes, and I don't care where else it goes. It goes wherever the hell it wants.
Yeah, that's
Just not in the eyes. That's my final answer. Just not in the eyes.
Sweating eyes is the worst. Huh?
Oh, sucks.
That's-
Yeah, that does suck. You just
Or
be
the
out
ones
there.
where I don't know about y'all. I used to have sweaty hands, man. So when I would like sweat in my gloves for like practice and stuff, and I would like try to wipe it, but
It's
it's
all,
like sharp because it was the cutters, so it was like a little sharp when you come in. So I didn't want to cut my eye or anything, so I like hit the unpack one time, and I go to like catch it, but it would like my finger sweat would drop
Just
off, or I get a
all-
little bit. It was just not a good time, man.
Yeah,
Not a good
sweating
time.
eyes
I'm
is
sorry if
trash.
that's no one else can relate to that, but like I had sweaty hands. It was kind of gross. I
Yeah.
had to take care of my gloves. Those little things you put in your feet for like the smelly feet. Like I put that in my gloves. It's not good.
Yeah, I don't have sweaty hands. This one. No.
What would you rather trade with somebody? So let's say you guys were to pass off the baton on the marathon, and you guys are meeting up, and you have to change because you forgot the sweaty shorts or the sweaty socks. Which one?
Ooh.
I'll take the shorts, man. I ain't taking nobody's sweaty socks.
See, now this is
Take the shorts.
this
It
is a
what it
dilemma. Sweaty shorts. Like I ain't trying to have a rash. I'm almost down to kind of take the socks. But
Oof,
like
I
how
see what you're
sweaty are we
saying.
talking about? If it's damp,
'Cause
I'm
now
taking
we're-
the socks. If it's wet, I'm taking the shorts. Like there's a difference here. Damp, I'm taking the socks because I'm like,
Nah,
you know what?
socks are soaked.
I'll push
dog.
out of it.
We're running a 13K. The socks are soaked.
I just don't. I can't have that rash. That rash for
Sweaty shorts are
13K.
getting ball sweat in there.
Yeah.
That kind of changes my answer now
And
too,
it
because I didn't think about
stays,
that.
like,
I was like, I just felt like that would
man.
be easier, just kind of like.
I've
all
had
right,
a,
cool, just put the shorts
I've
on
had a
there.
bad rash one time from that when we went from we had a contact camp for 8 hours and then we went straight to a passing tournament that day. Terrible idea. I don't know whose idea that was. Awful idea. And I kept the same girdle on because I was like, what am I gonna change for? So I kept the same girdle on as we drove from that camp to the place, and it kind of dried out. And then when I got sweaty again, obviously, I had the worst rash, and I cannot tell you just the.
Just how brutal. It
Oh
was.
my god, it sucked. I've never
makes
had
sense.
like a groin rash before like that, but holy crap, man, that was
Fool
it
just
was
kept his
terrible.
girdle on the whole time.
I was like, what am I doing? I'm like
Yeah.
15 and invincible or whatever.
Yeah, I
Dude, it
feel
was so bad.
That's crazy.
But yeah, I'm
Ooh,
for
that
that
was
like
probably sucked
for
for a
previous
cool minute.
previous rash incident alone, I'm going socks.
Socks. All right, socks works.
It's tough. Like I would respect it if you like go the other way, but like I can't
see
do
what
that
you're
again, or I'd just be too scared of it that it would inevitably happen. You know.
Yeah, I definitely switch my answer to socks.
I'm in on that. Socks. Final answer. Socks. We're going with crusting, and we're going with socks.
Socks, as long as it's not in the ass.
You know, this would actually be a cool time to like. I'm just gonna give you guys like 2 different options that are in like the health and fitness world, and you guys kind of say which side you guys lean on.
All right.
With the first one being squats or bench press.
Oh, See, the thing with squats is if you do it correctly, then I would say squats. Bench press to me is like it's cool and all, but yeah, I'm definitely leaning squats.
I am going with bench press just because I could never get it to where it didn't hurt my back.
Yeah.
That's like my own person. I didn't know how to lift when I was a kid, and that kind of scarred me. And I haven't done heavy squats since, but I definitely felt more comfortable benching than squatting. I don't know what this is in context to, but I'm just rolling.
You're just
I'm rolling
going
bench. Yeah, I'm going bench.
I'm going squats. That's cool.
Whatever. I hope I win. The final tally is crusting, socks, and bench.
Socks and bench.
The next one would be, let's say, pre-workout or post-workout. If you're gonna work out and you want like some kind of supplement, which one are you going with? If you can only pick one.
I would say pre-workout for me.
See, I gotta go post. I have like, I don't know, a sensitive stomach, but I definitely like can get worked up and just be like, well, gotta go to the bathroom right now.
Oh yeah,
That's like the worst feeling.
I think we
Just
talked about this, but
mid-workout
that's why I don't eat in the
bathroom
morning.
is so terrible. It just stops
Yeah,
everything.
yeah, it really
so I'm
does
going
suck.
post, just knowing like, all right, I'm gonna
good.
get into it as long as I got something.
Yeah, no,
I'd rather have pre than post if I haven't eaten anything. But if I'm like ready, like if I,
Yeah.
as long as I'm not like empty,
Yeah, it's
post.
You have to be on empty for pre-workout for sure, because then once it gets it going, then you're like, oh yeah, gotta go.
We actually have a question from If Mick Then once again. What up, If Mick Then? What do you think of balloon animals as fashion, like hats and stuff?
I could dig it. It wouldn't be a bad thing. I've seen some crazier stuff born.
Yeah, if you rock it, rock it. Like don't let nobody dull your sparkle, man. You do whatever you want to do.
Like
I'm in.
Like in the painter game, we believe that if it makes you feel better, do it.
Also, if you're dope as hell at making like
Actually, could get sick. I've seen some sick
balloon
ones.
clothing of some sort, like yeah.
Why not?
I'm sick. Shut up. You can't wear this. You don't know how to make this. I'm sick. You're
you have
not.
a shark on top of your head.
Yeah, I'm
Just
in.
walk out.
Like, am I rocking it everywhere? Maybe not. But like,
You could rock it.
will
You
I
can
go
rock
to?
it anywhere,
Will I
though.
go to
If you-
like lunch in that? Hell yeah. Will I go out? Like, it's a talking point. Because you
If
go out
you
and like
have the
meet some people. Like,
and the confidence to go out?
that's also
with
what
it.
I'm saying. If
That's
you
what I'm
if
saying.
you got the cojones, you got to rock it.
Yeah.
Man or woman, you got to go out. That's an easy talking point. And then you want someone. Obviously, if you're wearing that like balloon outfit of some sort, you're the type of person who's gonna want someone who's gonna also look to that as being dope as hell.
Yeah.
So it's the only way you're gonna find someone like that. You just rock it straight out.
That kind of reminds me of a friend that bought the Kanye jacket. That kind of looked kind of like almost like a balloon in the sense. It's like it was like blown up, and it was pretty cool too. He was like, "Hey, you want to check out my new jacket?" I was like, "Yeah, let me check out your new jacket." And then I was like, "That." I was like, "Oh, that's interesting."
But like as far as like fashion goes, I don't understand anything about fashion or like the runway, and never will. Like abstract art, I'm not really. I don't think that I have a good opinion on any of that. So take all of that with a grain of salt. I wouldn't trust me for anything.
Does that look good? Yeah, it looks good.
Nah, it's fine.
That's
That works out.
Does this match this? Yeah, that matches. You're good, dude.
That sounds great.
Yeah, that's cool.
The love. Thanks, Zara. Like Zara. The love doctor. I have been known to give. No, I don't give that good advice. Actually, don't listen to me.
Don't listen to me.
Now, what is your favorite meal of the day? And bonus to that, what is your favorite form of that meal?
I really love my TMOH Slam protein shake every single day. I swear, I love it. I love that thing. Like, I don't feel like myself if I don't have the Timo Slam smoothie.
Tell them again. What
Yeah, I
is
was just
it?
about to say, you got to explain that again to those of you who
Timo
weren't
Slam
here.
smoothie. 2 bananas, 3 raw eggs, a little bit of oatmeal, Nesquik, chocolate for flavoring, and oat milk,
Chocolate
ice,
for flavoring.
and it's it. That's what I love. You can throw some kale in there too if you wanted to.
For
That's-
flavoring.
How about eggs?
I already told the eggs.
Raw eggs? Okay.
3 of them.
Just pure
Solid.
raw eggs, just
Solid.
to the gullet.
Tastes amazing.
Danny,
Don't
guys,
knock it till
what
you
the
try
heck
it.
is that?
Don't knock it till you try it. That's what I'm saying. Just try it. I'm still standing at 33 years old, so
Oh, man.
it won't kill you. Definitely won't kill you.
I used to love my when I was in grad school. I probably had the same lunch for 2 years. Maybe not every day, but like most of my days, unless I had leftovers. Most of my days, I had a thing of ramen with an egg. Only half the packet, and then you got to drain the water out so you don't get too much salt. Throw some sriracha on that thing, and then have a smoothie of usually mixed berries of like blueberry, strawberry, and then a little bit of mango. And I'd take a full banana and I'd put it in there.
Ooh, sounds good.
Maybe some frozen apples if I happen to get a bunch and just chopped them up and left them in the freezer. Throw a little bit of Greek yogurt in there, and then throw a little bit of peanut butter in there, and then
Good to go.
blend that thing up. Yeah, that was my lunch for probably 2 years straight. It was delicious.
Sounds good though, right?
Always
It's
had
like
the
it
egg.
just feels like
Yeah, I'm feeling extra hungry. I put
Yeah.
2 eggs in there.
Yeah, see, 2
Not
eggs.
raw though. I cook that in the water, and that becomes like mini poached, anyways.
I got one from If Mick Then again. Shout out to If Mick Then again.
Fuego.
When did you first begin working out? Did you wish you began earlier? And when is the best time to start as a kid teen?
You always wish you started earlier. That's gonna be as long as you keep consistent with, you're like, man, imagine if I did this like one more month of like hard. Imagine if I went hard for 1 month. Like that would have been. I feel like you always feel like you wanted to start early. Is that like a regret people constantly have? Like, man, I wish I came to you, 5 weeks earlier, or like 5 years earlier, for matter of fact. Like, is that a common thing that people come to you once they're training? Is that a common conception?
Yeah, I guess everybody wants to do. Oh man, I wish I think it's just kind of learning like what everything is. I think now it's a lot easier to start younger, because back in the day people were still figuring out, fitness. I started really getting into it probably like 22. I do wish, since I was an athlete in high school, I wish I took working out with the team that much more serious. Just because now knowing how my body moves. I mean, of course, like at that time, we didn't have the best fitness coaches. It was just some guy say, yeah, lift like this, do like that. So we still didn't get the education that, but I would say like 14. I wish I was like a freshman year when I started really going through, puberty and growing. It's like just doing more to strengthen my body. So like body weight stuff.
Yeah.
I think that's what I would start off with. Just body weight stuff, push-ups, try to do some pull-ups here and there, and core workouts. Definitely.
I'd say that's definitely an appropriate age. I wouldn't start lifting before like 12, 13. Like 14, you hit a little bit of growth spurt, you start putting like meat on the bones. Everything's got to adjust anyways. Anatomically, they say like once you not stop growing, but once you hit your first spurt and you kind of get used to your body, then you should start doing some stuff. So like in that aspect, I'd say 14, 15 for males. Females, usually a little bit earlier, so like 13, 14.
They grow into their full body.
Yeah,
Okay.
they grow a little bit quicker into it.
Oh, okay.
So yeah, I say 14 is a pretty safe bet to start at least taking it seriously. Same thing when I was in high school. I started to take it more serious later on because I had an older brother that like told me it.
Yeah,
He's like, you better
for
take
sure.
this seriously
Yeah,
because
dude.
you want to be big or whatever. I was like, yeah, I do.
Just
And so
stronger.
he-
It just
he-
feels better too. Just to
Yeah,
feel.
like he kind of put it as you're going to be better at your sport. Like this seems dumb, but believe me, like after a month of this, blah, blah. And anyway, but yeah, so bring it back about 14, 15, be a solid time to kind of maybe not taking it super seriously, but at least getting like
more than doing it than PE, because PE was just like fun, goofing off.
Get familiar with
yeah.
what you're doing, how to do things
Yeah.
appropriately, why you're doing things. You don't need to have
in-home
like a full
workouts.
You don't
Yeah,
need to
exactly.
have a 5-day regimen when
No,
you're
no, no,
14, but like learn how to bench properly, learn how to squat properly, learn
Yeah,
how
there's
to
so
just
many
the
YouTube
basics.
videos now. You know, people.
Yeah.
I mean, not all. You know, not everybody on there is giving the right advice, but for the most part, you can see majority of them. You know, trying to teach right.
Find the basics and stuff, and then start that. I started when I was about 13, as my brother started taking me into the gym, and then for football lifting and stuff. Like about 13 is when I started lifting. I wouldn't even say I ever became like a serious lifter until I was kind of like, maybe I was like 16, 17. I took it a little bit more seriously, but until I got later on into like my profession, did I really understand what was going on.
The kids that were actually pretty good in shape and probably stayed consistently in shape throughout the years were the kids that were in ROTC. You know, just running, push-ups, pull-ups, just like simple, you know, calisthenic stuff. And even some that I know still, like, they're still in pretty good shape from just ROTC training and super simple stuff, nothing crazy. They're not like out there just deadlifting and all the other stuff. They're just kind of just getting a workout in.
Yeah, but it's never too late to start. So as like cliche as that is, and I don't like cliches, it really, like, you can start now. It doesn't matter. As long as you're safe with everything, be all right.
Yeah, don't
slow.
ego lift.
Yeah.
If there's one thing, don't ego lift and always try to go crazy heavy.
Start slow. People stop and restart all the time.
True.
So it's never too late. But if you really want a good age, if you have like a kid or like a little brother, cousin, or a sister, whatever you want, yeah, early teens, not a bad start. Not a bad starting point.
Any more questions on the chat?
Yes. So, what sport did you wish you played when you were younger, and why?
I wish I played baseball. I think I'd be pretty good at baseball. I remember my older brother played baseball and got really bored standing out in the field all day, and he was like, "I don't want to play baseball anymore," and he just stopped. And so me and my twin brother, we're about 3.5, 4 years younger than him, and we looked at it, we're like, "Yeah, baseball is gonna be boring," and so we never played it. And I kind of think, I don't think I could hit worth a lick, but I think I could, like.
Would you be a solid pitcher?
I would have been like, I don't know about throwing it that hard because I was injury prone. Probably would have got hurt, but I think I would have been like
had Tommy John
a Gold
surgery.
Glover batting like Mendoza line. But I think I could have been like a Gold Glover. Like, that's irrational confidence in myself, though. Like, that's fine.
That's cool though. That's cool.
I don't think I could hit the broadside of a barn though. If I'm being fair here.
Ooh, sheesh. One sport that was actually pretty fun to me when I played it in PE that I thought it would be really cool, and would be badminton. Like, take that super professional, like be the Olympic guy.
Badminton's tough.
That's what I'm saying.
You know,
it was fun.
our
I
badminton team
liked
was
it.
dope. Like,
Yeah.
when I was in high school, they lost. I think our JV team lost like 2 games in 4
Sheesh.
years, and our varsity team did not lose a single match when I was in high school.
That's cool.
They were bad. They were just bad to the bone.
I just felt like it was just so cool and technical, and like you're running back and forth. Like, yeah, I definitely, if I would go back in time, try to be the best badminton player in the United States.
Yeah, in our area, we've sent a bunch of people for actually ping pong to the Olympics.
Oh yeah, I remember.
Like
you
in the
told me.
Bay Area, Mountain View area and stuff, like Santa Clara. Like, we had a couple from our alumni go
Sick.
to like the Olympics.
That's pretty
They're
dope.
like
That sounds
bad to the bone here. We have like this is like Texas football for badminton or for ping pong. Like, we're solid.
I just wish, like, also too. I remember we were talking about this too, but if I lived in an area where I could practice I think it's the triathlon, learn how to shoot and then ski.
Oh yeah,
I don't know what it's called.
yeah, not the decathlon.
Oh,
but
anyways.
yeah, the one where you can
ski,
shoot stuff.
I trained my whole
The
life.
winter
for that.
one.
The winter one, yeah.
That one's dope.
That would have been a fun one.
If Mick then again came by and said, both my older brothers did ROTC and are now in the military, so they're super jacked now.
Yeah,
They're
see.
big motivations for me. I'm 14 and started at 12.
Yeah, that's
Yeah.
awesome. Yeah. All your
As long as you're being safe with it, because even then, like you said, like, those ROTC kids, as long as you're doing something, like for the most part, you're still 14, man. Like you're not invincible, but like you can like do a lot of things that a lot of other people can't do. Just
Yeah, stay
specifically off your
consistent.
age,
It's
so.
all about consistency. Definitely. If they like you said, they're been ROTC, they're all jacked now. It's like that consistent calisthenics of just, your own body.
Running, cardio.
Yeah.
Having good cardio, no matter what your age, is always going to help later on in life. So having good cardio will allow you to stay in the gym for hours and hours and hours. Then you'll get that power.
Yeah,
but
for
having that wind is going to be just irreplaceable. I'll tell you.
That's pretty cool. Yeah. Shout out to your older brothers and to you.
Yeah, keep it in.
Anything else in the chat that we?
But we actually had. I'll never forget. You shall remain nameless. But there was this chick in my PE class. I could never beat her.
In anything?
No, in badminton.
Oh, in badminton.
Like she was bad. She was crazy good at it, and I played her at least 8 times in like a 4-day span. Got waxed every single time.
Because it's like cool. Like you
Waxed.
could like just drop it all different type of ways.
Yeah,
and it
dude,
looks
I'm
sick.
sweating. I'm like 17. I'm like just doing PE because I can at this point.
No.
I'm like,
I'm gonna get her.
varsity football player. We just won CCI. Like I'm ready to go, and she is waxing me. I'm dripping sweat by the end of PE. I'm like, yo,
She's all blouses.
yeah,
Blouses.
that's game blouses, and I
Sheesh.
couldn't like aim it. Every time I'd hit it, I felt like I hit it right back at her every time. She was bink, 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 just a little wrist, and it's like, and I try to predict it too, and I'd be like, ah! And then it just dropped right in it, and
You're like, damn.
man, she smoked me every single time.
It's a fun one. Definitely a fun one. We should have a Painter Gain badminton tournament.
And it's cardio in that is crazy.
It's because it's a lot of lateral back pedaling.
Yeah,
It's basically basketball just in a smaller, tight form. But I mean, of course, you're hitting something else too. But I'm just saying the movement of it just really reminds me of that because you're gonna have to jump sometimes. You have to bend back. Got to get really athletic with it.
If McNen trial badminton, dog, hit it
For real.
Hit it one time for the one time.
Just smashing it.
It's like Fargo said, I don't know what it was, but my high school badminton team was all Asians.
Hey, mine too. They didn't lose a single game, man.
They just
They're crazy.
They got it.
They're so good.
They're so good at it.
And it's like, hey, man, if
This must be
and they were
passed
better
down
than
from
me.
generations and generations. Like all they do is like, hey, for family barbecues, this is what we do.
But like I said, I couldn't beat her if I tried. And she
you.
wasn't even like the ace of the badminton team. She was just like one of.
You
I mean, she's one
suck.
of their better players, but she wasn't like the hey, yo, this person, she's going somewhere. It's like no, it's like she's good at badminton.
She just
In
had
comparison
one
to the rest of
swole
our school.
right arm, just
Oh my
smashing
gosh.
everything.
I mean, she was like 5'11". I mean, I'm like 6'1", so I mean, I can't really complain. But she was
Yeah.
5'11". She had the reach. She was hitting it.
Dang, I wish I was there to see this, witness
Oh, yeah.
just L's after L's after L's.
Yeah.
There was some. Oh, what sport or game are you sneaky good at?
Oh, I'm super good at pool, billiards, sneaky good.
I used to be pretty good at. I used to bowl around 200 in bowling.
Ooh, that's pretty good.
I
See,
could get up.
bowling?
Well, I like a 180. I've broken
That's pretty
200
nice
a few
though.
times.
That's super solid.
Yeah, I feel like
Well,
that
if
was,
you
I
could
was
get a
pretty nice at
consistent
that.
180, you're solid.
Like I could have hit amateur leagues and been like
cool.
walking around.
Like I'm alright. I'm
little
alright.
puffed
doing
out
my
chest.
thing. Yeah, I'm doing my
I
thing.
do have an irrational confidence that I have never lost one of the water balloon toss things. You know, like in high school, we used to
Oh,
have
you
it
have to
across the
catch it?
gyms. I've never dropped one. So I think my water balloon, my
We
mini
need to
water balloon
have the
catching
Painter
skills
Gain
are
Olympics
top
and
tier.
have
I think
different-
I'm top 1% in top 0.1% in little water balloon catching. Just having it catch it.
How would
the
you be with the
strategy.
egg, like the egg toss too? Think you could nail that egg toss too?
I think so. I think it's a little smaller. It might be a little bit harder to catch. I think it would slip through a little bit. So I'm not as confident with the egg, but I'm
But
confident
you like
in
the water balloons.
balloons.
Like the water balloons.
Confident in water balloon catching.
That's a
I think
cool
I'd
one.
still be like upper echelon of like egg catching too. But to this day, have not dropped like no
Soft
matter what
hands. You got soft hands.
baby showers, no nothing.
Soft
I've
hands.
never dropped it. I've never had it explode on me.
That's
Like
cool.
that's my irrational confidence, and I know it's probably not true, but man, I've not been proven wrong. I'll tell you that.
That makes sense. That's a good one though.
Danny said he's super good at beer pong and slosh ball. Do you guys know what slosh ball is?
Slosh ball.
What is? Do we have an explanation on that?
Slosh ball?
I've heard some really
Wait,
cool
is slosh
drinking
ball
games.
though? Oh no,
fun
no,
drinking
no.
games.
There's
but-
that. I don't know what it is.
Spike
It's like
ball?
yeah, that's
Oh,
intense.
All of
That's
my
so
brothers were all
intense.
pretty good at it.
Yeah, that's not. Well, yeah, you're
I'm the
jumping
worst of
around.
my brothers, and I was wiping some floors with some dudes.
Yeah, no, that's super intense. Like you're ready to play a game. They just made volleyball much more intense. It just in the compact area.
Shout out to Sarah like Zara at the baby shower games. There was a couple months ago where I had like 2 back to back. I used the
Did you nail the
butt strategy for nail the width. Of
okay, I was about to say that.
I just go straight butt on me, just butt to the front, within a half an inch every time, every single time.
That's funny. That's a good
Fire.
one.
The guess the marshmallows.
That's
Put 369 as a joke. 366.
Really?
Yeah, I got my $25 Amazon gift
There you
card.
go. Get that. That's funny.
I mean,
There's are some fun games like that.
kickball with beer. Wasn't there a movie about that?
Kickball with beer?
There was a movie about
Sloshball.
that.
Basketball.
Basketball.
Basketball. That
Well, they
was a
were
good
also
one.
chugging beers in that though.
They were doing everything on that one.
I'm in.
I mean, yeah, I'm pretty sure they were drunk.
I'm in.
I'm actually gonna pull up slosh ball for you guys
I'm in.
so you can see.
Don't you tempt me with a good time.
Slosh ball sounds hella fun. Kickball and drinking. I could work it.
Let's see.
Let's see.
All
This is
right.
just some like intro that they have.
They got a cool intro for slosh ball.
I just want Bob Ross playing for a little bit then.
Hold up, let me get to the good stuff.
Yeah, get to the good part. All right. Oh, because you have a beer in your hand.
Oh wow.
So when you reach second base, it's mandatory to fill up your cup. And you can't score unless you've successfully chugged your whole beer from there.
Oh, we got to play slosh ball.
That's a big old ball too.
It's probably so much harder to catch when you have something in your hand. Oh, I got it. Oh, I
With
don't
one
got
other-
it.
Everyone has to have one too. Dude, that's smart.
So they use the big one when there's 2 outs.
Oh, okay.
They're kind of talking. I don't know if you guys can hear. But they're
I
talking.
get a
little
little bit.
That's that guy was ready. Perfect. I love that
Slightly buzzed. Yeah, there
explanation.
you go. It's cool because it's like, yeah,
Yeah.
you're slightly buzzed.
There are
How many
plenty,
outs are there? I don't know,
there
bro.
are plenty of intramural
ball.
softball games where I had no idea what was going on all around me.
I'm down for some slosh ball.
I'm in.
It's cool.
Way to go, Danny. Good find.
Danny's
Good find.
Danny's the best at all
We need to
backyard
get,
games. For real, him and Muhammad. Shout out Muhammad. They are the kings of backyard games.
Wait, you guys know who is like weirdly really good at a lot of weird things? Mars.
Yeah, that makes sense.
I'll never forget, outside of like our pre-calculus class in high school, all of us, there was like up on the upper building, there were like little drainage cubes basically between on the upper deck. And so us and a couple of the other football guys took some, like, we were just making paper airplanes. We were like trying to, we'll get it in there one of these times, like a joke.
Yeah.
It was like we were at an assembly or something coming back. I don't know. We were outside and he goes, "Oh, really?" And he like fashions it into this like super paper airplane that like
That's cool.
he like took ours and like folded it 6 more times and made it like firm. And he was like, "Watch this." And first time into the hole. I was like, "What is wrong with you?"
That makes sense.
He's so good
super
at like
crafty
a bunch
that.
of weird things. Yeah.
Like, you gotta
super
take
crafty.
him to the carnival games because he'll probably be hella good at every
Like he's
single one of
cracked
them.
all of them. He already knows. Like, oh, I know how to do this one. He'll like do a roll this way to throw the ring. And he hits it every time or something. I'm like, what are you doing?
That's sick.
Yeah,
cool.
he's really good at a bunch of weird things. If I had to guess if you just gave me a really obscure thing to do, and it
could
was
nail it.
like for my
You got
life,
one
I'd
person,
be like,
you got
Mars,
one person.
Mars, get over here.
Hey.
I need you to do something weird. And just hit it home.
But just bring it home.
What we got here right now is somebody said you guys should do Tough Mudder.
I've heard of the Tough Mudder. How long is that? My brother's done that. That's long, isn't it? That's tough. Mudder.
And it's a mudder.
yeah.
It's a
Like,
tough mudder.
Fun kind of intended, but
Fucking
also
tough
like
mudder.
it's tough, isn't it?
It is. Let's let's like watch a little bit of it. Let's see what.
They have one in Big Sur. No, am I wrong?
crazy like obstacle courses.
Yeah.
I mean,
I'm down for the obstacles.
I'm down for stuff like that.
I'm down for like hard things that I'm just gonna be like, I tried a bunch of times.
I really
Why not
okay. I
make this
wanted. There
one?
was a goal I set before COVID that I really wanted to do, and I wanted because I didn't have nothing to train for. Because I'm like, I mean, I play basketball and stuff like that, but I just wanted something to be like, nah, take your exercise to the next level. I've always wanted to try American Ninja or that ninja thing.
Oh yeah,
Always wanted to try that, but
the American Ninja Warriors. They
Oh,
actually
American
had
Ninja
one of
Warrior.
the when I was in Idaho, they had one of the
there's gyms.
there's gyms. They had like an official course that was like on a middle school.
Oh, sick.
And then they would set that up for a couple things, and that was like their trials. If
I
you could
wonder-
make it through there, it was one of the courses there.
Wonder how many kids like broke their arm because they keep on trying.
Yeah, it was like not in the school, but it was next to the school, and
Okay.
it was like next to this like shaved ice place we would go to. It was really weird. It's out in the middle of nowhere. They're like, oh yeah, sometimes they do, Idaho American Ninja Warrior tryouts. And I was like,
Yeah,
oh,
because that's what I wanted. I was like, yeah, I would have to train a different way to get ready for that. Because I feel like I'm athletic enough. I could jump.
it's just a
It'd
weird
be
though.
more-
Grip. You got to do a lot of grips.
That's what I'm saying. Like, I think, I was just I'm not too
Train
bad.
a different way.
Yeah, just train a whole complete different way to, But it seemed cool. Seemed excited. You guys would have all came with me to Vegas and see me just not make it.
You get a.
But at least we went to Vegas.
That's fair.
So I got it. I think it's loading right now.
Okay.
In the meantime, if Mick then said, "How long are your gym visits?" I'm going to pause this for a minute.
So when I would go work out, I was very efficient. I got in, I got out. I'd usually go in late at night. I'd hit the 10 to 11 and be like 45 minutes. And I would hit about 2 or 3 circuits of 3 different exercises. That way I just was like, I'm not sitting here. I'm not sitting on a bench. I'm not like staring at my phone half the time. And so I would usually do 3 rounds of like 15-minute circuits or something like that, 10 to 15-minute circuits to keep it in.
Yeah, get in, get out.
Yeah, unless you're like super serious, you shouldn't really be taking more than an hour at a gym. Unless you're doing cardio, something like that takes 40 minutes or whatever you're doing. I get it. But like if you're weightlifting, you shouldn't. If you're in
Your
there for
body's
more
gonna
than an hour,
test
you're
out.
not doing the right thing, man.
And since you're younger, if you're asking for yourself, definitely 30 to 40 minutes, 45 minutes is like your muscle should be gassed by that
yeah,
time.
if you're not getting yourself tired in about 40 minutes or so, you need to.
change a couple things, but
Yeah.
for the most part, for me personally, I'm easily hour and a half in the gym, but I really am so detailed in rest times and just kind of just keeping in control of that. And at this point, my work volume is super high, so I'm able. It takes me a while to get through it. Plus, I like the longer workouts personally myself.
How long did you say?
Hour and a half.
Hour and a half. That's what Danny's gym visits are usually about hour and a half.
Yeah.
A popular time.
Yeah, because you could set it up to, for me, I would stretch for about 10 to 15 minutes off top. So
Yeah.
that takes a good amount of time.
This guy's got a GoPro. He's doing the Tough Mudder. It looks like it's an obstacle course.
Ooh, obstacle course. Okay.
From
I'm
what
in.
I had read, it's an endurance event series in which participants attempt a 10 to 12 mile long obstacle
Holy
course.
crap. What's up with
10 to
y'all
12
with 10
miles?
to 12, guys?
So, it looks
Let's bring
like-
it to like 4 to 5.
And it, from the looks
Like
of
at
it,
least give us a
it's
chance.
like in the wilderness.
Yeah. Oh, that's kind of cool though.
So this part right here,
Oh, somebody has to get a wheelbarrow somebody?
no, I think you have to go through like water or something.
Oh, man.
Yeah, I think I've seen this where they have that coming down. They also have like the
It's interesting.
And then you, I
like the
guess,
shock things where they're hanging down.
you swing across.
Oh
it.
my God.
Wow.
So basically, you're just trying out for the army. I was kidding. These are just tryouts.
More or less.
So I think I was trying to find it. I think
That's kind of cool. I mean,
I'm walking through each one of those, but I would kind of be down, I guess.
13 miles.
So right here, when
I'm
you
still
crawl
walking.
in,
It's like 3 hours of just trying to
still
get through
walking.
stuff.
there's a part of it comes up where you crawl under something, and it's like this netting of electricity.
Oh,
Yeah.
yeah.
So I've seen that where they just have like strings of
It's
it
a
and you're
tough
supposed
mudder.
to just run through it.
It's a tough mudder.
I forget the volts. It's supposed to be it's like a scary amount of volts, but it doesn't actually
But it's gonna give
bother
you a
you that
good
much,
little,
yeah.
Climb
Yeah.
some shit.
This is wild. Why?
Yeah, definitely a mental, endurance kind of thing. Because your body would be fatigued for sure, but
Only way
just
I'm
trying
doing.
to get through it. It's a
Yeah, only
mental
way I'm
thing.
doing something like that is I got like 3 people with me that are all just not. I couldn't be competitive doing something like that. I don't train enough for that.
No,
that's
that's
gonna
like
be a thing.
wild training. It's like I want
Yeah.
to get through this.
I can
in
never run
2
that to try to get
hours.
first. I'm gonna do that just to be like, let's all make this
like
together,
when you
and
do the
then laugh
Spartan
about
race.
it later about how stupid
Yeah,
this entire
when you
thing
do the
was that we
Spartan
just
race
did.
too, some people are there to try to do it for competition, and some are just doing it for fun.
Yeah, and if you are, dude, more power to you. Way to go.
Yeah,
Great for you. You
It's
and
tough.
only you can do that out of the 2 of us. Is you can do that.
yeah, for
Way to
real.
go, man.
cool, though.
Congratulations.
That's not bad. It's a cool little course, I guess. Somehow we got to get on Wipeout. Do the Wipeout course.
You guys remember? I think Daniel said.
Yeah, MXC? Yeah.
Oh, MXC.
Kenny Blanket
doesn't-
Shift?
Yeah,
And
MXC
Vic
was the best.
Romano. Oh, I love those guys.
Those are the best. That's where Wipeout came from,
Spike TV.
basically.
Yeah, it is. That's what it's based
Literally,
off of.
yeah, for sure. Heck of funny.
Miss
Shout out
that.
Spike TV, RIP, or
Also
he's
have,
still
I
out.
think it's like American Gladiator or something, where they do things like that.
You know what I always saw
That was
kind
on
of
the
cool?
Game Show Network or something.
There's like a professional tag thing. That's pretty cool. I
wild.
can see myself being good at that.
Professional tag is wild. I used to think
I'm
I was
nimble
like,
enough.
I used to think that was something I could be cool at, but nah, I ain't that quick. But yeah,
Yeah.
professional tag's pretty wild.
Yes.
I've seen like, man,
Could you imagine like if you put like professional athletes, like say basketball players playing professional tag? It's like seeing Kevin Durant
like
try to
Ty
go
Hill
through
trying to
stuff.
like
Yeah,
Tariq Hill trying to
ooh,
get
even
through that.
yeah,
Like
that's what I'm
that'd be.
saying.
Yeah, professional tag is wild.
Yeah.
And I wonder what like
Yeah,
their
it's-
athletes, like
it
you
gets
can see
hard,
some
look at-
now. I wonder what their like just numbers are athletically. Like how fast are these guys? What's your 40 time? Like what's Green's 40 time right now?
No, but the thing is
better.
Yeah.
I think like your
Sheesh. And then I mean, honestly, too, it's a mental game. Like you really gotta. Oh, they finally got him. But it's like a mental game. Like you really gotta outsmart your opponent too. You gotta shake them.
Yeah.
You gotta shake.
Danny said it's all parkour, folks. I actually makes
Yeah.
sense. It's parkour. And Maya Hafiz, what's up, Maya? Why is the one with glasses a floating head?
My name is Timo, and I'm a floating head,
He floats.
and I float.
I think they have like a time. Like
Yeah, you have to
a
evade.
certain amount of
You had to
time.
evade them for like 20 seconds, I think. Yeah, that's what it is.
20
Evasion.
seconds.
You did it.
20 seconds. I mean, that's still pretty quick. And,
That
but-
dude
I mean,
got
but-
cornrows. Hey, Green, he's got to be. That adds 0.1 to his 40 time.
Point
Or takes
one.
away.
The aerodynamics
I
are
think
much
that's
better.
What it is definitely like parkour.
Yeah.
Skills.
Yeah,
is what's
American Ninja Warrior mixed with parkour.
Which is cool.
Like, but I'm like, give me a combine for these guys, man. I want to draft a fantasy tag team.
I wonder how many
Would you play him at?
What do
corner.
you mean? Oh, like put him in.
I'll put him in corner. Oh,
Scat back, man. Give me him. That dude's slippery.
Punt returner?
Ooh.
Chase down the.
Yeah,
the
it's
punt
true.
returner.
That's a good call.
'Cause it's
Alright.
that quick.
'Cause you got
little
it quick.
moment where they
Yeah,
can't-
Whoop, whoop,
I'm
and then
in.
just
I'm
go.
in.
That's a good one.
That'd be wild, man. That'd be so cool. Like,
Yeah, I like all these little cool little sports. Yeah, extreme sports.
I love
you
it.
guys keep
Have y'all seen drone racing?
going. Ooh, that looks cool too. Seen
I've
that.
I've put on like a head. I have friends that have one of those things where they have the camera on their drone. I put the little things on, try to drive it. I got sick so fast.
It's just like
Yeah, I was like,
I can't play
gonna
video
puke.
games like that either too. If they're like too
the VR
fast
stuff.
enough,
Yeah,
oh,
dude.
no,
Kudos to
man.
everyone else who can do that. I can't. No,
Yep, gives me a headache.
I ain't
Quick,
into it.
can't do it.
I wish I could though. That seems kind of dope. But those drones are. Those people fly those so fast. It's like Formula.
I've
not
seen.
Formula One
I'm
racing,
starting
but
to
it's
see
like-
much more on just like going through social media. Is that people are sneaking in drones and recording like festivals.
Yeah.
So they're kind of just having to go through the crowd all
Go around,
crazy,
yeah,
all the
trying
way
to get on
around,
top.
just
Because
get
what are you
them
gonna
in.
do? Like shoot it over an airspace? Like
Yeah,
whatever.
yeah,
If you make it in, you make it in.
Yeah, so that's been pretty cool too. Because I mean, just being technical, how it flows and everything. Like some people are really good at it.
I got my main man, Mick. He said, on the first visit I ever had to the gym I'm imagining, I was sore for the night. Since then, I don't have felt really sore at all after my workouts. Am I doing something wrong, or am I just not working out as hard? I still feel myself tensing up and stuff, but I never feel too bad after.
Slow down on whatever you're doing. So if you're doing whatever bicep curls, instead of just pumping them out, just try to go slower on them and have a longer hold on things. That's generally the biggest mistake I see with people who are first going to the gym is going to be, I'm pumping this out. I want to get this, get it in, get it out. But really holding it like, all right, I'm going to do a bicep curl, but it's going to take 3 seconds from the peak to get all the way down. That'll build a little bit more muscle. Yeah.
Definitely slow down your tempo for sure, because then you're just doing this to do so
you
many.
wanna,
You're
you
like,
wanna
I
make
gotta
it
get
to
to
where
15.
it's,
Like, all right, cool.
You know, manageable, but you also want to like have more quality. Again, cliche, super not great to say all the time, but like your quality of the workout like really matters a little bit more, and you're gonna get more tired.
Yeah,
because that's just
it's
longer time that you're using the muscle and less time that you're breaking. In essence, so more efficient workouts will probably be more effective for you.
Yeah.
Because you can tire yourself out as like maybe not
just
cardio
tired,
standpoint,
yeah.
but like like just mentally, I've done so many things, and then you're not actually getting the full thing at it without having to try to increase your weight or do whatever. But just take everything a little bit slower, or have purposeful. Make the last set be really slow on all of them and go till failure type of thing.
Yeah.
That'll help out. Of you can do your first couple sets normal.
Yeah.
You get to your last set of whatever it is. Do that one as
And,
slow as you can
ki-
possibly control it. Kind of thing.
And then switch it up always, so your body can never adapt to exactly what you're doing every single time, because your body will adapt to it and it's not going to feel the same. So like you say, tempo works, or your last set you are switching it up. There's things called a drop set, where you're working at one weight for the whole time, and on the last set you drop it about 50% and you pump out the last one you got there too. So just kind of those small little variables of really kind of tricking your muscles, just that thinking that it's doing something different when it's really not. But yeah, just basically your muscles just work on an all or nothing principle. So got to give it your all.
Yeah, try that at the end of whatever set you're doing. Do a drop set at the end where you just pump out as much as you can until failure.
Yeah,
And
it should definitely do it.
And it
Definitely
shouldn't
do
add
that.
too much more time to your workout, and
Nope.
it should give you, that
a
last
really
thing.
good pump.
Be aware of there is something called DOMS, delayed onset muscle soreness. That's like a prevalent thing. So you might not get that soreness till like 2 days later, where you get its peak soreness. So just be aware of that. But
And always protect your joints, all your joints. Be careful with all your joints and just movements of stuff like that. Don't overdo it, because then you have to start back from square one if you mess anything up in there.
yeah,
For sure.
and you don't necessarily have to be. I don't know if that's a good or bad like thing to have in the back of your mind, but you don't have to be sore every time. Especially if you're seeing like improvements,
True.
If
Yeah.
I'm getting stronger and I'm doing stuff, maybe you have good vascular like motion, maybe you have a really good like post stretching program, or maybe you're like just have a lifestyle to where you can like get through that stuff without having to be sore. So I wouldn't base it all on that, but like you can definitely get yourself sore.
Yeah, as long as you're also eating correctly too, your muscles will just absorb all the good food that you should have, the nutrients that you should be having too. So yeah, just eat right, keep going at it, and push yourself a little bit.
Yeah. All right. Well, thanks for joining us. That was Active Chat. We love hearing you guys. Like Foggo.
Yeah, perfect.
Glad we can make it back.
What was his name again?
Mick.
It's
Mick.
Yeah.
Yeah, shout out
Mick, thanks for
Thank
coming
you.
in.
Yeah,
We'll-
great questions. We're usually here on Mondays. Mondays around 9ish. I would like to say 9ish Pacific time.
Check the IG on there, and if you got any questions that you think of throughout the time, send them in on there, and we'll answer them. We'll let you know when we answer them.
Yeah, definitely. I think next week we will also do another demo for you guys for sure. We'll
Yeah.
figure out what muscle part.
Let them see. Is that still?
Oh, is it still? Nah, it's
No,
not
you
bad.
got a little sunshiner in there.
Yeah, cool. Yeah, because today we did the suction cup, and
Yeah, we did a little bit of
we
cupping
definitely recommend those. But yeah, my name is Timo.
My name is Dr. T. This is Painter Gain.
Bang.
Thanks for having us.
That was fun.
forgot how hot it is to stream.